ಸ್ವಲ್ಪ ಏನ್ ಹೆಚ್ಚಿದ್ರೆ ಮಾತ್ರ ಯಾರು ಲ್ಯಾಪ್ಟಾಪ್ ಕನೆಕ್ಷನ್ ಮಾಡ್ತಿದ್ರೆ ಅಲ್ಲ ಹಾಕಿದ್ವಿ ತೋರ್ಸು ತಲುಪಿದ್ವಿ 1 2 3 4 5 5 ಜನ ಕಲ್ಸಿದಾರೆ ನಿಮ್ಗಲ್ಲಿ ಹೇಳ್ಬೇಕು ನೀವು ನಿಮ್ಮ ಮಕ್ಕಳಿಗೆ ಬ್ಲಾಕ್ ಮಾಡ್ರಿ ಯಾಕಂದ್ರೆ
ऐतिहासिके ऐदं प्राथम्येन अस्माकं देशे प्रचाल्यमाने संवादकार्यक्रमे सम्मिलिताः स्मः।
महागणपतये नमः। प्रणो देवी सरस्वती.
We will be starting with the Pratijna, then we'll state the Hetu, followed by the respective.
Pratigna, Daiva Vyapashraya Chikitsa is Shrestha.
According to the Hetu, these are the Hetu. First one is Pramanika Grantha Paramarsha Viralat.
All these further can be explained with the help of the Drishtantas.
So the Upanayam is, the above stated Drishtantam shows that the number of scientific literature regarding Daiva Vyapashraya Chikitsa is negligible.
Reach to the Nigamana that Daiva Vyapashraya Chikitsa is Shrestha.
Let me first tell our main aim is Parapaksha Dosha Vachana. And
the very occurrence of a Vyadhi or disease can be seen in the later parts of Krita Yuga.
and while going through these books, references on Deva Vyapashraya Chikitsa and its components are very less.
And importance of snana according to months with different timings resulting in different effects as mentioned in Garuda Purana.
Chakravarti comment about the Deva Vyapashraya, that is Devam is Adrishtam. Devam Adrishtam.
Usage of Vaidurya, Mukta, Mani in Raktapitta Chikitsa, Krishna Chikitsa, Madhakya Chikitsa, Vatashonika Chikitsa.
The Sattva point that you were saying, if it is included in your group, then who will be defending the groups? Like either you will be or the other.
They both can be included, wherein Sattva-Vajaya is not Shrestha is what we have been emphasizing.
If Deva Vyapashraya was that much Shrestha, why did Acharya mention Yukti Vyapashraya and Sattva Vajaya before Deva Vyapashraya?
If Daiva Vyapashraya Chikitsa is Shrestha Chikitsa, then why both the Acharyas, Vagbhat, Acharya Vagbhat and Acharya Charan, have not mentioned the assessment of Daiva?
I will come to that. Deva Vyapashraya Chikitsa is based on an Adrishta principle. Okay, Adrishta. So it is by definition not observable and testable. That's what we told.
Mahamrityunjaya mantra, and it has showed that there will be a decrease in the GCS scale also. So it is well proven with the study already.
How your Ashukaritva, how the Deva Vyapashraya Ashukaritva is going to act, and how you are explaining the Shresthatva of that Deva Vyapashraya Chikitsa
In this code.
like in
All
this.
procedures, if we are doing a mantrocharana before that, that is the customary practice for the successful completion of all the events. So
You mean we cannot use any drugs. We have to use drugs specifically seeing the condition.
So when we take Sattva-Vajaya and Yukti Vyapashraya and Deva Vyapashraya, it can be based on the context.
Particular money has been mentioned. That is there. A drug specificity is there.
Visheshat Adosha Prakopanurupa. It is not following your Tridosha Siddhanta. So if you are trying to apply Tridosha Siddhanta.
Used for the debate, the Vadamarga Padas, 44 Padas can be used in the research proposal.
What is conceptualizing and materializing this type of the activity successfully, and also taking pains to coordinate the different colleges.
I congratulate all the three teams. I feel that all the three teams have taken this program very seriously. That is the most important thing.
We ask many questions, we interact with the students, but the depth of the knowledge for continuous 3 hours, it was very visible.
ऐतिहासिके ऐदं प्राथम्येन अस्माकं देशे प्रचाल्यमाने संवादकार्यक्रमे सम्मिलिताः स्मः।
महागणपतये नमः। प्रणव देवी सरस्वती।
We will be starting with the pratigna, then we'll state the hetu, followed by the respective.
Putting forth our pratigna, Daiva Vyapashraya Chikitsa is Shrestha.
Coming to the hetu, these are the hetu. First one is Pramanika Grantha Paramarsha Viralat.
All these further can be explained with the help of the Drishtantas.
So the Upanayam is, the above stated Drishtantam shows that the number of scientific literature regarding Daiva Vyapashraya Chikitsa is negligible.
Reach to the Nigamana that Daiva Vyapashraya Chikitsa is Shrestha.
Let me first tell our main aim is Parapaksha Dosha Vajana. And
the very occurrence of a Vyadhi or disease can be seen in the later parts of Krita Yuga.
And while going through these books, references on Deva Vyapashraya Chikitsa and its components are very less.
And importance of snana according to months with different timings resulting in different effects as mentioned in Garuda Purana.
Second comment about the Deva Vyapashraya, that is Deva is Adrishtam. Deva Adrishtam.
Usage of Vaiduriam, Muktam, Mani in Raktapitta Chikitsa, Krishna Chikitsa, Madhakya Chikitsa, Vatashomita Chikitsa,
The Sattva point that you were saying, if it is included in your group, then who will be defending the groups? Like either you will be or the other.
They both can be included, wherein Sattva-Vajaya is not Shrestha, is what we have been emphasizing.
If Deva Vyapashraya was that much Shrestha, why did Acharya mention Yukti Vyapashraya and Sattva Vajaya before Deva Vyapashraya?
If Daiva Vyapashraya Chikitsa is Shrestha Chikitsa, then why both the Acharyas, Vagbhat, Acharya Vagbhat and Acharya Charya, have not mentioned the assessment of Daiva?
I will come to that. Deva Vyapashraya Chikitsa is based on an Adrishta principle. Okay, Adrishta. So it is by definition not observable and testable. That's what we told.
And it has showed that there will be decrease in the JCS scale also. So it is well proven with the study already.
How your Ashukaritva, how the Deva Vyapashraya Ashukaritva is going to act, and how you are explaining the Shresthatva of that Daiva Vyapashraya Chikitsa in this code.
All procedures, if we are doing a mantrocharana before that, that is the customary practice for the successful completion of all the events.
So we cannot use any drugs. We have to use drugs specifically seeing the condition. So when we take Sattva and Yukti Vyapashraya and Deva Vyapashraya, it can be based on the context.
Particular money has been mentioned. That is there, a drug specificity is there.
Visheshat Adosha Prakopanurupa. It is not following your Tridosha Siddhanta. So if you are trying to apply Tridosha
Used
Siddhanta,
for the debate, the Vadamarga Padas, 44 Padas can be used in the research proposal. Whenever
What is conceptualizing and materializing this type of the activity successfully, and also taken pains to coordinate the different colleges.
Congratulate all the three teams. I feel that all the three teams have taken this program very seriously. That is the most important.
We ask many questions, we interact with the students, but the depth of the knowledge for continuous 3 hours, it was very visible.
Dinacharya. Dinacharya is basically an ideal daily schedule for us, which takes into account the nature's master cycle and suggests the actions to follow.
निगमनम् आयुर्वेदोक्त दिनचर्या एकमेव दीर्घायुष्यं प्रति राजमार्ग नास्ति.
धर्मो रक्षित रक्षितः तथा दिनचर्यो रक्षित रक्षितः.
जैसे कि दिनचर्या निशाचर्या ऋतुचर्या यथोदितम् आचरण पुरुषः स्वस्थः सदा तिष्ठति नान्यदा.
I'm doing daily. I'm doing Nityachara. Today morning, I get Kaphagrasta something. How I'll get to how these Dr. DP will go for, we don't have enough time to sleep only. Then how will you wake up early in the morning before
Sushruta has taken Madhuras also. In that, like only Madhuka he has mentioned.
Swami Vivekananda.
Hello, check. Yes, good afternoon. I welcome all participants to occupy your seats. Sthapana, Pratisthapana, and Vitandavada.
Ayurveda is one of the world's oldest Indian holistic healing systems, has a global demand and acceptance as a major health and wellness provider. It is a perfect blend of solution to the modern day health challenges. The best of Ayurveda is nurtured in the ambits of Keli Academy of Higher Education and Research. The pious commitment of inculcating tradition, technology, and innovation is deep-rooted in the world's best abode of Ayurveda, Keli's Shri Basapanna Mallapanna Kanganwadi Ayurveda Mahavidyalaya, Shahpur, Belgavi, Karnataka, aptly known as Keli Ayurveda, the first institute in India to have a constant crown of NAC and NABH accreditation. With all its academic, research, moral and social responsibilities, Keli Ayurveda is marching its journey towards its centenary celebrations. Keli Ayurveda is a proud and remarkable wing of Keli Academy of Higher Education and Research, a deemed to be university of global standards with a consistent NAC A grade. Also has its ranking in NHRD, Swachh Bharat, NIRF, and many more feathers in its crown. Keli Ayurveda has more than 65% of greenery and listed as a clean and a green campus. The campus of Keli Ayurveda is spread over 11 acres of land and an exclusive herbal garden over 32 acres of land. The library, with all modern amenities of management system, has a vast collection of books, e-books, journals, etc., accounting to over 35,000. The 24 hours reading room and a spacious study area in the library makes the library user-friendly to the students. The library, in addition to the available books, is also Wi-Fi enabled for easy internet access for a hassle-free flow of study materials. Institute has 14 departments for undergraduate and postgraduate teaching and training, with renowned, experienced, and also young and dynamic team of facilitators.
We are masters of Ayurveda literature. Ayurveda is the future.
We are the masters of Ayurvedic pharmaceutics. Ayurveda is the future.
We are Ayurveda drug manufacturers. Ayurveda is the future.
We are masters in Ayurveda pharmacology and pharmacognosy. Ayurveda is the next future.
We are the masters of Ayurveda diagnostics. Ayurveda is the future. We are the masters of Ayurveda obstetrics and gynecology. Ayurveda is the future.
We are masters of Ayurveda pediatrics. Ayurveda is the future.
We are the masters of Ayurveda toxicology. Ayurveda is the future.
We are the masters of Ayurveda community medicine. Ayurveda is the future.
We are the masters of Ayurveda inclusive medicine. Ayurveda is the future. We are masters of Ayurvedic surgery. Ayurveda is future.
We are the masters of Ayurvedic ophthalmology, ENT and dentistry. Ayurveda is the future.
We are the masters of the Panchakarma. Ayurveda is the future.
Keli Ayurveda Hospital has its rich heritage of serving the needy from local to global areas for more than 90 years. Hospital has premises with state-of-art standards and is reputatively an NABH accredited hospital. The spacious interiors of the hospital are well equipped with the traditional and modern equipments. Patients visiting the hospital have a high satisfaction rate under the care of experienced Vaidyas, nursing, and other support staff. Hospital has over 20 specialty and super specialty OPDs, has wards for all economy status with equal care, has potential treatments for neurological, cardiac, cancer, infertility, developmental problems, respiratory problems, skin disease, lifestyle, and lipid disorders, in addition to routine OPD of all specialties from pediatrics to geriatrics, including surgical, gynecological, and obstetrical care. KLE Ayurveda has a commanding central research facility wing with all modern research facilities. The staff involved in CRF are highly trained and are potentially contributing to analysis, research, and publication. As a result, CRF has 16 completed and ongoing government-sponsored research projects, 22 private pharmacy-sponsored research works, more than 56 in-house research projects, more than 480 standard publications, more than 33 animal experiments, more than 880 analytical books of herbal, mineral, and herbo-mineral products.
We are expertise of Ayurveda research. Ayurveda is the future.
Ayurveda is the native science that India can export to the world. Considering the past, present, and future, we call our institution to the international standards and to teach Ayurveda and to serve the humanity on the lines of tradition, technology, and innovation. We prepare our students on the global standards. KLE Ayurveda is a vibrant campus with international standards, having enriched with human values and ethical values. The students aspiring career in global standards must opt KLE Ayurveda for education in Ayurveda.
I am an Ayurveda fertility specialist.
I am an Ayurveda dietologist.
I am Ayurveda student beauty consultant.
I am an Ayurveda endocrinologist. I am Ayurveda cardiologist. I am an Ayurveda psychiatrist.
I am Ayurveda oncologist.
I am an Ayurveda rebuttal.
I am Ayurveda consultant for lipid disorders and breast.
Ayurveda is the future.
Check.
Check, check.
Check, check.
Check. Check 1, 2, 3.
Ayurveda is one of the world's oldest Indian holistic healing systems, has a global demand and acceptance as a major health and wellness provider. It is a perfect blend of solution to the modern day health challenges. The best of Ayurveda is nurtured in the ambits of Keli Academy of Higher Education and Research. The pious commitment of inculcating tradition, technology, and innovation is deeply rooted in the world's best mode of Ayurveda, Keli's Shri Basavanna Malapanna Kanganwadi Ayurveda Mahavidyalaya, Shahpur, Belgavi, Karnataka, aptly known as Keli Ayurveda, the first institute in India to have a constant round of NAC and NABH accreditation. With all its academic, research, moral and social responsibilities, Keli Ayurveda is marching its journey towards its centenary celebrations. Keli Ayurveda is a proud and remarkable wing of Kelly Academy of Higher Education and Research, deemed to be university of global standards with a consistent NAC A grade. Also has its ranking in MHRD, Swachh Bharat, NIRF, and many more feathers in its crown. Kelly Ayurved has more than 65% of greenery, enlisted as a clean and a green campus. The campus of Kelly Ayurved is spread over 11 acres of land and an exclusive herbal garden over 32 acres of land. The library, with all modern amenities of management system, has a vast collection of books, e-books, journals, etc., accounting to over 35,000. The 24 hours reading room and a spacious study area in the library makes the library user-friendly to the students. The library, in addition to the available books, is also Wi-Fi enabled for easy internet access for a hassle-free flow of study materials. Institute has 14 departments for undergraduate and postgraduate teaching and training, with renowned experience and also young and dynamic team of facilitators.
We are masters of Ayurveda literature. Ayurveda is the future.
We are the masters of Ayurvedic pharmaceutics. Ayurveda is the future.
We are Ayurveda drug manufacturers. Ayurveda is the future.
We are masters in Ayurveda pharmacology and pharmacognosy. Ayurveda is the next future.
We are the masters of Ayurveda diagnostics. Ayurveda is the future. We are the masters of Ayurveda obstetrics and gynecology. Ayurveda is the future.
We are masters of Ayurveda pediatrics. Ayurveda is the future.
We are the masters of Ayurveda toxicology. Ayurveda is the future.
We are the masters of Ayurveda community medicine. Ayurveda is the future.
We are the masters of Ayurveda medicine. Ayurveda is the future.
We are masters of Ayurvedic surgery. Ayurveda is future.
We are the masters of Ayurvedic ophthalmology, ENT, and dentistry. Ayurveda is the future.
We are the masters of Panchakarma. Ayurveda is the future.
Keli Ayurveda Hospital has its rich heritage of serving the needy from local to global areas for more than 90 years. Hospital has premises with the state-of-art standards and is reputatively an NABH accredited hospital. The spacious interiors of the hospital are well equipped with the traditional and modern equipments. Patients visiting the hospital have a high satisfaction rate under the care of experienced Vaidyas, nursing and other support staff. Hospital has over 20 specialty and super specialty OPDs, has wards for all economy status with equal care, has potential treatments for neurological, cardiac, cancer, infertility, developmental problems, respiratory problems, skin disease, lifestyle and lipid disorders, in addition to routine OPD of all specialties from pediatrics to geriatrics, including surgical, gynecological and obstetrical care. Keli Ayurveda has a commanding central research facility wing with all modern research facilities. The staff involved in CRF are highly trained and are potentially contributing to analysis, research and publication. As a result, CRF has 16 completed and ongoing government-sponsored research projects, 22 private pharmacy-sponsored research works, more than 56 in-house research projects, more than 480 standard publications, more than 33 animal experiments, more than 880 analytical books of herbal, mineral and herbo-mineral products.
We are expertise of Ayurveda research. Ayurveda is the future.
Ayurveda is the native science that India can export to the world. Considering the past, present, and future, we call our institution to the international standards and to teach Ayurveda and to serve the humanity on the lines of tradition, technology, and innovation. We prepare our students on the global standards. Daily, Ayurveda is the vibrant campus with international standards, having enriched with human values and ethical values. The students aspiring career in global standards must opt Ayurveda for education in Ayurveda.
I am an Ayurveda fertility specialist.
I am an Ayurveda dermatologist.
I am Ayurveda skill and beauty consultant.
I am an Ayurveda endocrinologist. I am Ayurveda cardiologist. I am an Ayurveda psychiatrist.
I am Ayurveda oncologist.
I am an Ayurveda dermatologist.
I am Ayurveda consultant for lipid disorders and breast. Ayurveda is the future.
दिक्कालाज्जनवच्छिन्नानन्तचिन्मात्रमूर्तये स्वानुभूत्यैकमानाय नमः शान्ताय तेजसे नमस्सभायै अद्य शुभेस्मिन् दिने शुभेस्मिन् समये वयं राष्ट्रस्तरीयसंवादकार्यक्रमे तत्रापि चतुर्थसंवादकार्यक्रमे सम्मिलिताः स्मः। कार्यक्रमेऽस्मिन् नानादेशतः स्पर्धार्थम् अत्र छात्राः समागताः एवं संवादस्य रुचिं प्राप्तुं नानाविभागतः अत्र समागताः छात्राः प्राध्यापकाः एवं प्राचार्याः। कार्यक्रमस्य आदौ मङ्गलम् आचरेत् इति कल्पिता श्रुतिः। तदर्थं यथा शिष्टाचारं कार्यक्रमस्य निर्विघ्नपरिसमाप्त्यर्थये मङ्गलम् आचरति KLE BMK आयुर्वेदमहाविद्यालयस्य छात्रा डाक्टर् भूमिका।
कृपया सर्वे प्रार्थनार्थम् उत्तिष्ठन्तु। नमामि धन्वन्तरिम् आदिदेवं सुरासुरैर्वन्दितपादपद्मं लोके जरारो भयमृत्योर्नाशनं दातारमीशं विविधौषधीना शङ्खं चक्रं जलौकां दधदमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिहृद्यां शुकपरिविलसन् मौलिमम्बोजनेत्रं कालाम्भोदोज्ज्वलाङ्गं कटितटविलस चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवन प्रौढदावाग्निलीलं प्रौढदावाग्निलीलम्। धन्यवादः।
मङ्गलम् आचरितवत्यै डाक्टर् भूमिकायै धन्यवादाः। सम्प्रति कार्यक्रमे समागतान् सर्वान् अपि स्वागतं व्याहरति अस्माकं महाविद्यालयस्य संहितासिद्धान्तविभागस्य अध्यक्षा डाक्टर् सविता बी पडशेट्टिवर्या।
सतत अध्ययनं वादः परतन्त्रम् अवलोकनं तद्विद आचार्यसेवा च बुद्धिरधिकारे गणः। Constant study, discussion, knowledge of allied sciences and association of learned experts endows one with a knowledge and intelligence. With this quotation from Sushruta Samhita, I take this opportunity to start this event. A very good afternoon to one and all. Today, we all have gathered here for the special and the unique event, that is SAMAVADA-4, a national level debate. On behalf of KLE Ayurveda and Department of Basic Principle, I am here to deliver welcome address to all the people present over here. Firstly, I heartily welcome Dr. B.S. Prasad, Sir, President, Board of Ayurveda, NCISM, New Delhi. It was Sir who had taken initiation of starting of this Samvada, that is national level debate, when he was a former principal of our institution. Today, we are happy to say that, Sir, we have been started with this in offline mode. Welcome you, Sir. It is a great pleasure to welcome our beloved principal, Sir, Dr. Suhas Kumar Shetty, Sir, who is a backbone and supporting pillar to conduct this event, even though it was in online mode till today. Today, Sir has made this event to get started with the offline mode. I welcome you, Sir. Next, I would like to welcome Dr. Prashant A. Sir, Principal, Ayurveda Mahavidyalaya, Hubli, who has joined this in virtual mode for this event. Welcome, Sir. Next, I take this opportunity to welcome Vaishali Kuchevar Madam, Dean of Ayurveda, Mahatma Gandhi Ayurveda College, Varda. And I also take this opportunity to welcome Dr. P.G. Jadar, Sir, Dean, Vice Principal, for joining this event. Welcome both of you, Sir and Madam. I also take this immense pleasure to welcome Dr. Shivakumar Harti, Sir, Associate Professor, Department of Swastarutta, All India Institute of Ayurveda, New Delhi, who has accepted our invitation and joined this on virtual mode in his busy schedule. Welcome you, Sir. I also take this an opportunity to welcome all the mentors, Dr. Rajkumar, Sir, Dr. Shruti Madam, and Dr. Praveen, who have guided the students to take part in this Samvada-4. Welcome all three of you. At the last, I take this opportunity to welcome all the faculties, participants, PG scholars, and UG students, and all the virtual viewers for this Samvada-4. Welcome all of you. Now I request Dr. Praveen Biradi, Sir, Assistant Professor from the Department of Basic Principle, to welcome our Principal, Sir, and all the mentors. With this welcome address, I conclude my speech. Thank you, one and all.
समागतेभ्यः स्वागतं व्याहृतवत्यै अस्माकं महाविद्यालयस्य संहितासिद्धान्तविभागस्य प्राध्यापकायै डाक्टर् सविता बी पडशेट्टी वर्यायै अपि सर्वेषां पक्षतः हार्दं स्वागतम्। अद्य प्रचाल्यमानस्य संवादस्य कार्यक्रमस्य मूलकारणीकर्तारः सन्ति अस्माकं विद्यालयस्य शिरोमणयः डाक्टर् सुहास् कुमार् शेट्टी वर्याः, अस्माकं विद्यालयस्य प्राचार्याः। तान् अहं प्रार्थयामि संवादकार्यक्रमस्य आरम्भार्थम् अनुमतिं प्रददतु इति।
आरभ्यतां संवादः।
धन्यवादः। सम्प्रति महाविद्यालयस्य संहितासिद्धान्तविभागस्य सहाध्यापकान् डाक्टर् प्रवीण् बी भिडी महोदयान् प्रार्थयामि अद्यतन संवादकार्यक्रमस्य विशेषज्ञानां परिचयं प्रददतु इति।
A very good afternoon to one and all. So, and heartily welcome to Samvada-4, a national level debate. It's an immense pleasure to introduce our today's expert, Dr. Shivakumar Harti, sir. Sir is currently working in All India Institution of Ayurveda, New Delhi, as an associate professor. And sir has completed PG and PhD also. And now sir is a PG and PhD guide at University of Delhi, Faculty of Ayurvedic and Unani Medicine, New Delhi. Sir has experience about UG teaching experience 15 years and PG teaching experience 5 years. And sir has completed his UG in our BMK Ayurveda Mahavidyalaya Belgaum. Sir is a alumni. It's a proud moment for us. And sir has completed MD in Swastarutta department in SDM Ayurveda Medical College, Hassan. Sir has completed PhD in our own institution, that is KLE University, Belgaum. Sir had done so many projects. He is an investigator for development and validation of Prakriti Assessment Questionnaire funded by CCRAS and co-PI for Ayurgenomics project. Identification of genomics correlates of Prakriti in healthy individuals from Dravidian population of North Karnataka. And next, sir is project, revitalization of local health. And sir has published so many articles in the journals. In that, sir has a framed Ayurveda MCQ item analysis in JIM. And sir has Ayushcharya 2018, a national conference on Dinacharya and Rutucharya for public health promotion. Sir has also published articles in the IJAM as a development and validation of self-recorded Swasthya assessment scale, and also published Surveying the Storm Through a Shelter of Ayurveda, international webinar on integrated approach to combat COVID-19, a conference report. And sir has also published Effect of Anuvasana Basti with Kshirabala Taila in Sandigata Vata. And also sir published Trisutra Conservative Initiative across ethnically and geographically diverse Indian populations and the Journal of Ethnopharmacology. And sir has given so many guest talks also. In that, sir given the guest talk in Guwahati. The title is Diet and Lifestyle Protocols in Lifestyle Diseases. And sir has given the guest talk in Haridwara, that is Sampling Techniques and Basic Statistical Methods Workshop on Research Methodology. And sir has given the guest talks in New Delhi, the topic on Epidemiology, CME on Swastarutta, All India Institution of Ayurveda, New Delhi. And sir has given the guest talks in Epidemiology in the Ayurveda, CME in Swastarutta, Sushruta Ayurveda Medical College, Bangalore. And Mapping Evidences for Prevention of Lifestyle Disorders at Pragati, that was held in this institution only. And next is about, this is our proud moment also, that is Ayush Ministry deputed sir as a speaker, Festival of India in Bangkok, Thailand. It's a proud moment for Ayurveda fraternity also. And sir given the guest talks in Epidemiology at ROTP in Hassan and Biomedical Waste Management at ROTP Swastarutta Department, that was held at Amrita School of Ayurveda, Kollam. And Pharmacovigilance in Ayurveda at CME Research Methodology, that was held in the Nasik. So with this brief introduction, I will conclude my introductory speech about today's expert. And also I welcome you, sir, for this event. And thank you for the giving opportunity for introduce our today's guest. Thank you.
Thank you very much.
एवम् अद्यतनविषयविशेषज्ञाः न केवलं विशिष्टाः अतिविशिष्टाः इति वक्तुं शक्नुमः। तेभ्यः सर्वेषां पक्षतः पुनः स्वागतं। सम्प्रति अस्माकं पुरतः वेदिकायां स्थापना, प्रतिष्ठापना एवं वितण्डवादसदस्याः सम्मिलिताः सन्ति। ते इदानीं स्वपरिचयं स्वयमेव दास्यन्ति। आदौ स्थापना पक्षतः अस्माकमेव विद्यालयस्य छात्राः सम्मिलिताः। तान् अहं प्रार्थयामि स्वपरिचयं प्रददतु इति।
A very good afternoon to one and all. Myself, Dr. Jacqueline Pereira, first year PG scholar from the Department of Dravyaguna.
Hari Om Namaskara. I am Dr. Pooja Hulgod, second year PG scholar from the Department of Panchakarma.
सर्वेभ्यः नमस्कारः। अहं भूमिका द्वितीयवर्षस्नातकोत्तरछात्रा रसशास्त्रम् एवं भैषज्यकल्पना विभागतः।
Good afternoon, everyone. My name is Dr. Siddhi Prabhudesai, second year PG scholar from the Department of Swasthavritta.
A very good afternoon to all. I'm Vaishnavi,
from second year PG scholar from the Department of Kamarabhriti.
स्थापना पक्षस्य सदस्येभ्यः स्वागतं पुनः स्वागतं। द्वितीयः गणः अस्ति प्रतिष्ठापनागणः। एते स्नातकोत्तरछात्राः महात्मा गान्धी आयुर्वेद महाविद्यालय वार्धातः समागताः। तान् अहं प्रार्थयामि स्वपरिचयं सभायै प्रददतु इति।
Myself Pooja Basnal, first year PG scholar, Department of Samhita Siddhanta.
Good afternoon all. Myself Tanika Yadav, first year PG scholar, Department of Kai Chikitsa.
Good afternoon, everyone. I am Dr. Yogesh Yadav from Department of Shalya Tantra, MGACH.
Good afternoon, all. My name is Dr. Arun Khatri, Department of Balrog.
Good afternoon, everyone. Myself, Dr. Riya Rathore, PG scholar from Department of Kamarabhriti.
प्रतिष्ठापना सदस्येभ्यः अपि सर्वेषां पक्षतः स्वागतं। सम्प्रति वितण्डवादगणः। एते छात्राः आयुर्वेदमहाविद्यालयः हुब्बळ्ळीतः समागताः। तान् अहं प्रार्थयामि स्वपरिचयं सभायै प्रददतु इति।
Good afternoon, everyone. Myself, Dr. Chaitanya Hiremat. I'm from RSPK department.
Namaste to all. Myself, Dr. Priyanka K, second year PG scholar, Department of Samhita Siddhanta.
Good afternoon, everybody. Myself, Dr. Sinchana Yuval, second year PG scholar from Rognidan department.
Good afternoon, one and all. I'm Dr. Apurva Koteshwar from Department of Shalya Tantra, second year PG scholar.
Hello, everyone. Myself, Shruti Naik, Department of Panchakarma.
वितण्डवादगणसदस्येभ्यः अपि सर्वेषां पक्षतः हार्दं स्वागतं। सम्प्रति विशेषज्ञद्वारा अद्यतनसंवादकार्यक्रमस्य चर्चाविषयस्य उद्घोषणम्। अहम् अखिलभारतीय आयुर्वेदसंस्थातः अस्माभिः सह वर्तन्ते डॉक्टर शिवकुमार हर्ति महोदयाः। तान् अहं प्रार्थयामि अद्यतनसंवादकार्यक्रमस्य विषयस्य उद्घोषणं कुर्वन्तु इति। I request Dr. Shivakumar Harti sir to announce the topic of today's Samvada.
Thank you very much. Good afternoon to all the dignitaries for this August gathering. Dine Dinacharya, Dinacharya, Dinasya Vacharya, Dinacharya, Charanam Charya. So topic of today's scientific debate is adaptation of Dinacharya practices are not possible in the present scenario for global public, general public. Thank you.
सम्प्रति उत्तमः विचारः अत्र चर्च्यते। आयुर्वेदोक्त दिनचर्या परिपालनम् अद्यतनकाले जनैः शक्यं वा न वा इति। अद्य चर्चां दृष्ट्वा वयं तत्र किं शक्यते उत न शक्यते इति पश्यामः। सम्प्रति संवादस्य कार्यक्रमस्य आरम्भः। तदर्थम् अस्माकं महाविद्यालयस्य संहितासिद्धान्तविभागस्य प्राध्यापकान् डॉक्टर प्रभाकर हेगडे वर्यान् प्रार्थयामि संवादकार्यक्रमस्य अग्रे चालनार्थम्।
Thank you, sir. Good afternoon, respected principal, sir, principal of and the dean of other participating colleges, and respected faculty members as well as participants. So let's start the debate from first round. So as we know that there are two rounds, and connected with the second round, we have a query round, question answer round. So for the first round, I invite the Sthapana members. Before that, the topic announced for this today's debate from Vishaya Visheshajna, that is, adaptation of Dinacharya practices are not possible in present scenario for general public. I repeat this. What is the statement? Is to prove from your side, adaptation of Dinacharya practices are not possible in present scenario for general public. So with this intention, so we start the debate. Prathama Vartula, that is first casual round through Panchavya Vakyas, that is Pratijna Hetu Udharana Upanaya Nigamana. I give chance to Sthapana members. Let's start the debate, and I will hand over the chance to Sthapana members. Sthapana members.
To commence our Panchavya Vakya, our pratigya is Sampraptike Kale Janehi Ayurvedokta Dinacharya Paripalanam Na Shakyam. Adaptation of Dinacharya practice is not possible in present scenario for general public.
The hetus are Dinacharya Vishaye Adnyanat, that is lack of knowledge among the general public, Paschatikaranat, westernization as an outcome of Kali Yuga, and Anavadhanacha, that is change in attitudes or priorities.
दृष्टान्तः अविद्यायाम् अन्तरे वर्तमानाः स्वयं धीराः पण्डितं मन्यमानाः दन्द्रम्यमाणाः पर्यन्ति मूढा अन्धेनैव नीयमाना यथान्धाः युगे युगे धर्मपादः क्रमेणानेन हीयते गुणपादश्च भूतानामेवं लोकः प्रलीयते लोके एष विषयानुरञ्जनो दुःखगर्भमपि मन्यते सुखम् आमिषं वडिशगर्भमप्यहो मोहतो ग्रसति यद्वदण्डजः.
Here, in the Upanayam, it is important for us to note this. Andhenaiva niyamana yathandaha. Blind carrying a blind. Here, blind has two meaning. That is, ignorance has two meaning. Complete ignorance, and the second one is flawed assumption. Avidya can be of two types. First is complete ignorance, that is, the person has no idea of Dinacharya. Second one, flawed assumption. He thinks that it is Dinacharya, but it is not Dinacharya. The second thing, due to this, the person is unable to recognize his own flaws. That is, Swayam Dhiraha. He thinks he's perfect. And he also goes about in guiding others as well. So that is Paryanti Mudaha Andhena Iva Niyamana Yathandaha. Second thing, second comparison is Yuge Yuge Dharma Padaha Kramena Neva Hriyate. It is the rule of nature that the guna of discipline is going to decrease. The sattva guna is going to decrease from yuga to yuga. We are at the Sandhikala of Kali Yuga, and due to this decrease in the sattva guna, there is going to be lokaha praliyate. The end of the Kali Yuga is going to be due to this exact nature. That is why it is not possible. The third comparison is dukkha garbhamati manyate sukham. In the current scenario, there are various distractions, amisha, due to which people end up in misery and they are unable to follow Dinacharya.
निगमन अथ साम्प्रतिककाले जनैः आयुर्वेदोक्तदिनचर्या परिपालनं न शक्यम्. Hence, we conclude that adaptation of Dinacharya practices is not possible in present scenario for the general public. Thank you.
Okay. Thank you, Stapna members. As the Svabhava taking towards what we are becoming the same is the points from Stapana. So there is no wrong as the statement they have given. Okay. So we take this first round from Pratishtapna group. So your point is adaptation of Dinacharya practices are possible in present scenario for general public. You have 5 minutes plus 2. You start your debate for the first round through Panchavakyas. Pratishtapna.
We, the Pratisthapna group, MGAC, Vardha, put form the topic adaptation of Dinacharya practices are possible in present scenario for general public. What is Dinacharya? Dine Dinacharya, Dinacharya, Dinasyavacharya, Dinacharya, and Charanam Charya. Prayojan of Ayurveda Swasthasya Swastha Rakshanam can be established by following Dinacharya. It maintains balance between dosha, dhatu, and mala. These are the components of Dinacharya. Sharp increase in the ratio of non-communicable disease to communicable disease last 2 decades, with cardiovascular remains the leading cause due to disturbed lifestyle. The limitation of current scenario like high recurrence rate, lifelong medication, etc. reduces the quality of life that can be improved by following Dinacharya. Dinacharya regulates biological clock, restores physical and mental health, induces longevity. अद्य चतुर्थ संवाद विषय अस्ति इदं काले जनानां आयुर्वेदस्य दिनचर्या पालनं कुरुते शक्यं वर्तन्ते. एतस्य स्थापनस्य कृते पंच हेतव पंच दृष्टान्त पंच उपनयना वयम् आदरन्ति. प्रथम हेतु ब्रह्म मुहूर्त उत्तिष्ठेत्. ब्राह्मी मुहूर्त उत्तिष्ठेत् स्वस्थो रक्षार्थम आयुष. Second, the famous quotation of early to bed, early to rise makes a man healthy, wealthy, and wise. Cortisol hormone is at the peak at early morning, responsive for anti-stress and immunomodulation activity. Following are some scientific evidences that proves that waking up in the Brahm Muhurat is beneficial for health. In current scenario, if Ratri Jagran is due to using gadgets or stress, then should follow Ratri Charya, Nidan Parivarjan, and Sattvaja Chikitsa. If Ratri Jagran is due to working hours like watchmen or doctors, they should do Diva Swapna for Ardhakala. Dvitiya Hetu is Mukh Shuchita. Mukh Shuchita in terms of Danta Dhavan, Kaval, Jivha Nirlekhan that brings Dorgandhi Nasha, Shleshma Upkarshan, Mukh Vaishadhya Nasha, Annabhiruchi, Somnasya Janana, and prevents Ostputan, Parushya, Mukshosha. These published articles and books prove that oral hygiene decreases plaque, tongue coating, bacterial count, and other oral diseases. Thus, Drishtant proves Hetu. In present scenario, if individual is doing Dantadhavan by additive toothpaste or wrong material, to be advised to use herbal twig or toothpaste of Katutik Kashaya Dravya Pradhan or use Trivarga Tridray Dantamanjan. Educate those people using gandush with chlorhexidine or wrong material or not doing at all, then they should be advised about the benefit effects of good gandusha. Tritiya Hetu is Abhyanga. The benefits of Abhyanga are Drishti Prasad Pushtayu Swapna Sutvakrit Dadikrat. Abhyanga normalizes circadian rhythm by increasing tryptophan and serotonin level, which induces sleep, as shown in the figure. Various studies prove that it prevents Akala Jara, thickness of the hair, regulates cardiac function, normalizes circadian system. Thus, Drishtant proves Hetu. In present scenario, for person having time for do Abhyanga should be educated about the proper material, especially for Jara Shrama Vathat people. Person don't have time to do Abhyanga, they should be advised to do at least on weekends or especially for Shira Shravan Pada. Chaturth Hetu is Vyayama. Sharir Ayas Jananam Karma Vyayam Sangitam. Benefits are Laghavam Karma Samarthyam, Deepto Agni Vedasakshaya, Vibhaktaghan Gatratvam, Vyayam Atupa Jayate. Drishtant. Various studies shows that it is effective in Alzheimer's diseases, decreases blood pressure, decreases HbA1c in type 2 diabetes mellitus patient, and decreases cardiovascular diseases. Upnayan. Thus, Drishtant proves Hetu. In present scenario, those having time to do Vyayama should be educated about the proper way and correct timing. Those who don't have time to do Vyayama, they should at least do Chankramana, Yojan Shat Adhikam Va Gachet, and you should use stairs instead of lifts. Hetu 5 Nasya. As Acharya told, Nasa hi Sirsodvaram, Nasya prevents Urdha Jatrupat Vikara and increases immunity and can be used at any age as Ajanavarnam Shastam, Pritimarsham Bastivat. Nasya can be taken in any 15 kalsa as producing their effect as Shruto Shuddhi, Klamanasha, Indriya Bala, Dantadar effect. During COVID-19, Anutel Nasya was used as an immunomodulator. These references from various articles show that it relieves from symptoms of COVID-19 patient, even effective in coma patients showing increased in Glasgow coma scale. Thus, Drishtant proves Hetu. In present area, Nasya should be practiced at it is easy to administer, requires no assistant, less time consuming. Due to time constraint, 5 aspects of Dinacharya has been explained in the presentation. In the same way, other Dinacharya aspect can be explained, including, and we should educate about the community, develop SOPs, creating awareness and customization for propagation without deviating from the core concept. एतानां पंचहेतव पंचदृष्टान्त पंच उपनयनां साहाय्येन वयं घोषितवन्तः यत् अस्मान् नियमन् अस्ति प्रतिज्ञा. The adaptation of Dinacharya practice are possible in present scenario for general public.
Thank you, Pratishtapana, by giving multiple reasons and with brief justification how the adoption of Dinacharya practices are possible in present scenario for general public. You have told in brief and through Panchavakyas. So we'll move to Vitandavadins. What is your stand in the first round? So if you brief your the statement, so it would be better in the assembly. Vitandavadins.
ओम धन्वंतरे नमः. शस्त्रं शस्त्राणि सलिलं गुणदोषप्रवृत्तये पात्रापेक्षिण्यतः प्रज्ञाः चिकित्सार्थं विशोधयेत्. Weapons, scripture and water have merits and demerits depending upon who uses it for what. As a Vitandavadi, our role is Parapaksha Doshavachana Matrameya. We are not supporting either Sthapana or Pratishtapana. Here our aim is to come with a good outcome by this Vada. As the court says, the aim of art is to represent not the outward appearance of the things, but their inward significance. As Chanakya in his Niti Shastra mentioned, Vade Vade Kalaham Jayate or Vade Vade Tattvam Jayate. So here we are looking forward for a good tattva which is helpful to our mankind. Thank you.
Okay, thank you, Hubli Avredam Mahavidyalaya group, as well as titled as Vitandavadins, and they are waiting for today's debate very keenly, which is going to be done by Sthapna and Pratisthapna. Later, they will take the queries in the third round, connected with second round. So, for second round, now we are in second round after having finished the first round, the Vishesha Vartula, that is Dvitiya Vishesha Vartula. So, you need to justify your topic elaboratively. For this, you will have 15 minutes plus 5 minutes extra will give if at all anything is left to convey, which is more intense to say in the assembly. So minimum 15 minutes will give. Okay. So Sthapna, what is your detailed justification on this topic? How it is not possible?
To know how it is not possible, we need to first understand what is Dinacharya. Is it just an everyday routine or is there a more deeper meaning to it? So, in order to know in detail about Dinacharya, we need to take help from other Samhitas and Smriti Granthas. For example, from Bhagavad Gita of Veda Vyasa, Sadachara Smriti of Acharya Madhva, Sangraha Nityanusthana of Sri Govinda Panditacharya. So, Dinacharya can also be interpreted as Nitya Shodhana or Srota Shodhana. If we look at the 10 Bahirmukha Srotas, 2 Nayana, Dve Nayana, Dve Karna, Dve Nasa, Ekavaktra, Mehana, and Guda Bhaga, we can see that to cleanse each of these Srotas, a Dinacharya procedure can be helpful. But is the general public aware of these, aware of the cleansing that is needed for all these 10 body channels? That is the question we need to answer here. And then, so if the 9 srotas deal with Bahir Shruti, there is one more srotas that is Mastaka Randhra, or it can also be called as Sahasrara. It deals with Antashuddhi. So the Sadvrita part of Dinacharya can be considered under Antashuddhi part, Sadvrita Paripalana, and Dharana of Vegas that should be, that are Dharani Vegas. So, but in the current scenario, we see that there are lots of lifestyle disorders and mental disorders. This is due to the lack of physical and mental cleansing. So again, the question is Dinacharya just a karmacharana or is there a deeper meaning to it? So let's see the role of Adhyatma in Dinacharya. So in every action, there should be Deva Smarana, according to the Smritikaras. Acharya Madhva says, Yasmin Sarvani Karmani, Sanyasa Adhyatma Chetasa, Nirashir Nirmamo Yati, Param Jayati Sochuta. This has also been quoted by Sri Krishna in Bhagavad Gita. He also says, Smrutva Harim Samuthaya Kruta Shaucho Yathavidi. In every action, we should remember God. Acharya Sushruta also explains individual Adhidaivata to every Indriya. He says, for Disha, there is, for Shrotas, there is Disha Devata. For Tvacha, there is Vayu Deva. For Chakshu, there is Surya Deva. So when we are applying Anjana, we are not just applying Anjana. It is a worship to the Surya Deva. That is Indriya Abhimani Devata of Chakshu. This concept is not practiced in general among the general public. So this has been practiced by one of Ayurveda Acharyas, that is Sharangadhara Acharya, who says, who while explaining the process of respiration, he says, Kanthat Bahir Niryati Patum Vishnupada Amrutam. The process of respiration is not just a process of respiration, it is worshipping Vishnu. Oxygen is compared to Vishnupada Amrita. Amrita, which is getting Udbhava from Vishnupada. So every little minute action is a worship of God. That is also like Sandhya Upasana, Dvaukala Upasprushet. Many of these Dinacharya practices are a worship of God. Kayana Vacha Manasendriyarva, Buddhyatmana Vanusrutas. Then there is surrenderance. Karoti Karomi Yadyat Sakalam Parasmai Narayana Samarpayami. That is from Srimad Bhagavatam. So every action is a remembrance, and there should be humility and then surrenderance to God. So this deep understanding is not present in general public, and there are various impediments to it. That is occupational, because of the various occupations, and time factor. Acharya Shukacharya says, Nidraya hriyate naktam yavayena navam vayaha divacha arthe haya rajan kutumba baranenava. People say they do not have time to practice Dinacharya. This is because Nidraya hriyate naktam yavayena navam vayaha. Either they indulge in sexual activities or sleep during the night. The night is spent in that. And then the day During the day, they go to their jobs, various professions, and the day is spent in that. Where do they find time for Dinacharya? Bannanjay Govinda Panditacharya gives a new meaning to it for this time factor. He gives a psychological meaning, calling it non-interest. It's not that people do not have time. It is that people are not interested in practicing Dinacharya, as seen in the current scenario. That is one factor. And then the religious factor. Many people think that these acharyas like Dvaukala Upasruchit, these are for a specific community. But no, it is not so. Every person belonging to every community can practice this and then go about their jobs, daily routine. This is one reason. And then there is a laziness factor, that is non-interest. And then there is the perception that is impossible. People generally perceive that, oh, this is for great people, for common people, how can we practice this? So where are we going wrong? Some of these examples, we have seen this trend, no shave November. While in Sadvrita, there has been explained 3 prakshasya, keshashmashru, lomanakhan samhare. People go about without shaving their hair, mustache, etc. And girls have this fashion of new hairstyles of putting their hair over their eyes. It covers their eyes. So there is no sense of health here. They just, in the name of fashion and in the name of imitating Westerners, foreigners, Western lifestyle, Western routine, there has been changes in Dinacharya Acharana. For example, you can see people wearing ripped jeans, women wearing clothes which have holes in them, which is the opposite of what has been explained in Charaka Sutrasthana, that is Anupata Vasa and Sadhu Vesha. So this is because of the outward influence. We might have known the story of hunter's parrot and the sage's parrot. That is the influence in which one grows. So in the current scenario, there is a lot of Western influence due to which this behavior is seen. Srimad Ananda Tirtha Bhagavad also describes one more Siddhanta, that is Swabhava versus Prabhava. Swabhava is the innate nature, while the Prabhava is the influence of the outward surroundings. So in the current scenario, in the Kali Yuga, there is a lot of Prabhava of Western people imitating Westerners. So that is one reason for this.
Adding to the point that has been said that we have to know or understand the deeper meaning of itself Dinacharya practice, I would like to add that the whole concept of Dinacharya, when it was come up, the way of living was, what was the root or what was the main attention? It was of the palan of dharma, artha and kam, moksha. But by looking in the current scenario, in the shifting trends and the hustle-centric people, the more of living is more focused, or what we are focusing on is on artha and kama, leaving apart dharma and moksha. Now come to the specific. First, that is said in the Dinacharya is Brahma Muhurte Uttishte. There is 2 main aspects that has been said in the classics, that is specific time period for rising up, penultimate muhurat of the night. But this concept itself is elusive in general public. And there's another aspect of calculation of Brahma Muhurta. Now coming to the other aspect, after waking up, there has been said that Adhyayana, Jeena Ajina Nirupana, and perceptions of auspicious dravya such as Dadi, Gogruta, Sarshap, Bilba, Gorochan, these has to be practiced. But these practices pertaining to waking up is not practically apt in the current scenario. I would like to brief about the current scenario, that is the sleep pattern of general public in present scenario, and why this Dinacharya practice is not practically applicable. First and foremost, the main reason is demographic transition due to the urbanization. This has led to a gross and unprecedented change in the behavior and cultural trends. The sleep hygiene as well as the circadian sleep-wake rhythm has been affected. So this whole concept of Brahma Muhurte Uttishte cannot be generalized to the general public. Now coming to the second aspect, that is the Shauch Vidhi. I would like to begin and say that what is the relevance and social acceptance of classical Shauch Vidhi that has been mentioned. It has been stated that in Shauch Vidhi with reference to Malotsarga Karma, it should be done facing north in the dark, sitting silently, covering the head with cloth, attending the urge, commencing in its own without initiating the Vega, na tuyatna udiryat. Moreover, there is specification of what place to be selected for Malotsarga and purificatory methods that has to be carried out by mud water. This all has been specified. We have to ask ourselves, what is this the classical relevant to current scenario, because it is neither practical nor socially acceptable by general public. The conventional normal bowel movement that we see is appreciated in less and less population, and the spectrum of even stool type is shifting towards irregularity in the bowel habits that manifest in the form of straining of stool and incomplete stool evacuation. So this whole concept of Shauch Vidhi is not practically applicable in current scenario. Now moving on to the third part, that is the Vyayama. In Vyayam, the concept of Ardha Shakti Vyayam has been said, and it has been said specifically to Ritu. But on the other hand, WHO guidelines has clearly stated a physical activity for adults, which is similar entire year. So how can we say that specific Ardha Shakti can be applied only to Shita and Vasant Ritu, and in Mand activities are to be done in Grishma Ritu? When it is pertinent that with increase in the prevalence of diabetes, we have to increase the physical activity, which has been clearly stated in the WHO guidelines. So I'd like to say as well as this specific Ardha Shakti Vyayam concept is also not applicable to current scenario.
Coming to next area, Danta Davana. I know we all will be brushing our teeth, right? Maybe not twice a day, at least once a day. But is that what is mentioned in Dinacharya? Definitely not. We'll start with the materials used. So first thing is materials used mentioned was Arkanya, Grodha, Kadira, Karanja, all those things. And Acharyas have mentioned like from which place you have to take these drugs and all. And coming to current scenario of the usages, if you see there was a study which was done on evaluation of oral hygiene practices in an urban Indian population. So there it is mentioned that around out of 1,000 participants, around 7.80% of people only opted for neem twigs, not any other materials, only the neem twigs. And coming to next paper, if you can say that, okay, urban people will not go with the neem twigs, we can see what about the scenario in the rural population. So in the rural population also, you can see here clearly 700 members were participated in that study where neem sticks were preferred only by 38%, and most of them were gone with the toothbrush. Now coming to next thing. So even if we can tell that, okay, we'll advocate this, that we can use all these Agrakanya, Grodha, Kadira and all. But how will you identify? Identification is a major factor where identification is of two types. One is that we have to identify what kind of twig will match for us. Another thing is the identification of the plant. So for this, Acharya has mentioned Aveksha, Ritum cha, Dosham cha, Rasam Miryam cha Yojit. Like if there is a predominance of Kapaja dosha in our body, we have to go with Tiktarasa. Pittaja is there, then we have to go with Madhura Rasa twigs. And Bataja is there, then we have to go with the Kashaya Rasa twigs. And next we'll go with the availability. Coming to availability, there is a paper where they have mentioned the status and consolidated list of threatened medicinal plants. So there it is mentioned like 90% of the medicinal plants are facing threat. And if you see the drugs which has been Acharyas has been mentioned in that, Asana, Yerimed, all these are listed under red list in IUCN status. And next is the dimension. As I already mentioned, it is not that some random twig we can take. There are typical dimensions that has been mentioned by Acharya, like Dwadashangulam, Samastaulyam, Kaninyagra Samastaulyam, Dwadashangulam, Subhumijam, and Rijvagranthi. So which is practically, it is very difficult for us to find it out. And next, most important thing is the time taken for brushing. So here Acharyas have told it is Ekaikam Garshayantam. That is one teeth you have to start brushing. First you have to chew the twig and then you have to start brushing, starting from lower side, each teeth you have to brush. Now again after that it is not over there. Again after brushing we have to apply Vapya Trivarga Tritayak Shaudra Kenacha Garshayit. So we have to do garshana with these churna also. So almost it is like 10 minutes almost it will take for us to complete the brushing. Do you know how much is the average time spent by an Indian in brushing the teeth? So for that, if we see, there was a research paper, evaluation of relationship between time of manual tooth. Here they have mentioned, like, even though Indian Dental Association mentions 2 minutes for brushing, an average Indian spends only around 30 to 60 seconds for brushing the teeth. And next, coming to contraindications, it is like everyone invariably brush the teeth, right? Do we assess ourselves like, do we have ajirna or do we have shwasa and all? That identification of the contraindications is not being being assessed properly by the general public. Nadia Tajirna Vamatu Shwasa Kasajvaratidi, there is a typical contraindications mentioned which the general public is not aware of. And next, coming to Abhyanga. Now, again for Abhyanga also, I would start with the time factor where it is mentioned like when we do oil massage, the time that is taken for the oil to reach the Majadhatu is 900 matra, which is approximately 285 seconds. So approximately it is that we have to do Abhyanga for minimum 15 minutes to cover the whole body. Now, that is not possible because of the hurry and how to say, as already my friends mentioned, nowadays we don't have the time to assess ourselves, to go to the bathroom itself. Then in that case, we cannot go with 15 minutes spending for Abhyanga. Next, coming to the procedure, it is mentioned like Anuloma Gati we have to go, which is not aware among the public. And then coming to contraindications are also not assessed, and affordability also. Affordability is like in recent study, according to Economic Forum, it is mentioned like 228 million of Indians are taking their expenditure of rupees 32 per day. So where can we go for an Tilataila, which is about 300 rupees per liter that cannot be used in a for a common man.
Thank you, Dr. Vaishnavi, for giving a brief justification regarding the charyas. Now, when Nasya, Dhumapana, Gandusha, Kavala, Anjana is spoken about, especially when Nasya and Dhumapana is spoken about, see, as we all know, those are procedures that has more specifications, right from the drug that we have to select, the method, the pose, the dose, the indication, contraindication. So there are a lot more specifications laid on those procedures. And I guess it is very difficult for a general public who doesn't even know an ABCD what it is to follow. If at all, if any general public follows it without any proper medical supervision or guidance, definitely they are prone to suffer from severe adverse drug reactions and so on. And also I have collected many justifications and survey studies where the awareness regarding the Dinacharya practices like Kavala, Gandusha, Anjana are very much prevailing in less amount. A study stated that 63% of the population were not even aware about the terms like Nasya, Vasti, Abhyanga, Langhana, Yoga, etc. If they are not even aware about it, how can we expect them to practice? And regarding Anjana, Dhumapana and Nasya, as we all know, we are moving towards an era of smartphones and where digitalization is dominating more. So whatever be the information, we are getting it only from the internets. So such internets, a study has conducted a survey of informations regarding herbal smoking. And it is very shocking to know that almost 83% of the information made available on such platforms was posted by common public. I repeat, it was posted by common public, and they had covered no precaution advisory regarding how much herbal smoke has to be intake, in what way it has to be intaken. If arises a complication, how to tackle with it, no information was made on that. So these kind of misleading informations will definitely take the public to a danger zone. And it is the same with Anjana even. It is unfortunate that the Anjana or in the name of kohl or kajal that is available in the market, it is a very unscientific form. And one study has also been conducted where the market available kajals, it includes all the branded kajals such as Maybelline New York, Lakme, even Himalaya, that it contains more than the permissible amount of lead. Actually, the permissible amount of lead should be only 20 parts per million, but shockingly, all those levels were crossing more than 36 parts per million, which would definitely lead to lead toxicity, conjunctival, and periocular pigmentation. So these are the references that I have shown from the article pic.
In the current times, it is seen that these kriyas like Pushpadharan, Mukhalepa, Utsadana, Udgharshana, Anjana are only used as a beautification process for special occasions or festivals. Also, these are gender biased, wherein only the female population uses or implements these. Again, another procedure called as Ushnisha Dharan, which is very commonly called a turban. It is only restricted to a particular community, mostly the Sikhs, which only constitute the 1.7% of India's population. And due to continuous pulling of the hair shaft or continuous wearing of the turban, there's a study which states that traction alopecia is seen in these male Sikh males. Sandhyacharya, which is also considered as a part of Dinacharya, it states there are some activities that are contraindicated in Sandhyacharya like Ahara, Maithuna, Nidra, Sampatha, Gati. But we usually see that evening walks are usually preferred by people who have a busy morning schedule. Also, late night studying is a prevalent feature of students of this generation. Also, there is an additive or to this present Ratri Charya, that is smartphones. Everybody, including even medicos, they will use smartphones or they will use the phones around 20 to 30 minutes before going to sleep at the end of the day. So this is a part of our routine. This has become an unsaid ritual. This is the results of an online survey that is conducted by our team members to know or to assess the knowledge of Dinacharya amongst the general public. And these are the results.
Be quick.
It is seen that 49.5% of the population is not aware of the procedure called as Nasya Karma. They don't know what is Nasya. Also, 45.7% of the people think that application of Kajala or Anjana is a beauty product for women. Also, 75% of the people think that practicing Vyayama or physical exercise every day is not possible for them to be practiced daily. We would like to conclude the slide, our presentation, by this quote by Ashtanga Hridaya, which states, Naktam dinani meyanti katam bhutasya samprati dukkha bhana bhavattevam nityam sannihita smriti, which states that a person who keenly observes his day-to-day activities throughout the day and night will be freed from sorrows. But in today's generation, where does anybody have the time to pay attention to his activities throughout the day? And according to all the other hetus that we have already mentioned, that is why Dinacharya cannot be practiced on a day-to-day basis by the general public. Thank you.
Thank you, Sthapana Group, for putting forth your statement, how it is not possible among the general public to implement this. And they have given several justification. Among them, the influence of westernization is much on us. And that is, we are not following all the three vargas very equally. And we are behind only Artha and Kama. And the Danta Davana process, like the processes, whatever they have explained, there are many difficulties to follow this. And for Abhyanga purpose, they explain that for each procedure, daily procedure, we need 300 rupees per liter. Okay. So according to the requirement of the tailor for individual. So many justification they have given, and the routine setup, whatever these days they have highlighted. So thank you for your justification on the statement, what you want to prove in the assembled hall. Now, moving on to the second group, that is Pratisthapana. I would like to tell that Sthapana has covered almost 15 to 20 minutes maximum. So I request Pratisthapana group to take over the discussion and prove and justify, elaborately mention what is your point, how it is possible among the general public to adopt or to follow the classical Dinacharya, what is mentioned in the Ayurveda. Pratishtha.
Thanks, sir. Namaste, judges, my worthy opponents, and members of the audience. Thank you for your attention and consideration. Throughout the course of this debate, we will be proving and justifying with scientific evidences the practicality, need of Dinacharya practices and its adaptation for general public in present times. So let's start with the very first element of Dinacharya, that is the Brahma Muhurta Uttishthit. Acharya Bhagbat had stated that the starting of Dinacharya by waking up at Brahma Muhurta. Brahme Muhurat Uttishthit Swastho Rakshartham Ayusha. It means to wake up at Brahma Muhurta. It is very much important for Ayu Rakshan and longevity of life. Brahma Jnanam Tadartham Adhenadapi Brahma Tasya Yogyo Muhurta Brahma means Brahma denotes knowledge of deity and Muhurta denotes time. Hence, it is considered as the best time for receiving Brahman or divine knowledge and worship. Our ancient Ayurvedic commentator, Indu, in Shashileka commentary on Ashtang Sangraha, has mentioned the concept of Ahoratra and its division in the 8 yamas. Out of that, we can conclude that the night has 4 yama and every yam has 3.75 muhurtas. Hence, the starting Murta of last Yama can be considered as the Brahma Murta. However, as there is no SOPs yet which can define the Brahma Murta, as this time can differ according to the seasons, hence one Murta, that is the 48 minutes before Suryodaya, should be standardized and it can be considered as the Brahma Murta. Also, the intake of food can also equally affect the sleep pattern, which further can affect the daily biological cycle of an individual. Hence, Acharya Bhav Prakash has mentioned in the text, like meals should be taken within the first prayer of night, and it should be slightly less in quantity than the forenoon food and devoid of the things that is difficult for digestion. Another point, according to Sushruta Samhita, the Hridaya is a site of Chetana. When the Tamogun increases, it results in the Nidra, whereas the Sattvagun increases results in wake up. This means that the pattern of sleeping or waking up depends on the effect of Sattva or Tama in Hridayagat Chetana. Also, in Ayurveda, Sattvagun is a Prakashak while the Tamogun is a sign of darkness. Sattvagun results in mutual well-being, mental well-being, freshness, positivity, while Tamogun causes awakeness, negativity, anxiety, depression, and loss of confidence. Similar work is done by the serotonin. It resembles the Sattvagun. And melatonin, it acts as a Tamogun. So which are secreted by the pineal gland, which is located in the dorsal aspect of the brain. Today's lifestyle, stress, changing food habits, office work causes the late night sleep and late morning awake. So it imbalances the level of secretion of serotonin and melatonin. That imbalance causes the depression, insomnia, awakeness, lack of positivity, and loneliness. The above lakshanas are of Manas Rog, so to avoid this, we need to accept and follow the Dinacharya and Sadvrit mentioned in Ayurveda. Our second hetu mentioned is based on the oral hygiene. Oral hygiene is inevitable for maintenance of good health. Here in hetu, as we can see, what our acharyas has mentioned in Ashtang Hridaya, that after the elimination of urine and feces, a person should clean his teeth with twigs of arka, nagrod, khadir, karanj, kakub, etc., which are astringent, pungent, and bitter in taste. That is katu, tikta, kashay, pradhan dravyas. This twig should be the size of the tip of little finger in thickness and 12 angulas in breadth. And the straight its top should be made like a soft brush, and the teeth should be cleaned without hurting the gums. Also, another reference which can be seen is from Sushruta Chikitsa Sthan. It mentions that the nimbak tiktake shreshtah, kashay khadiras tatha, maduko madhure shreshtah, karanjah katuke tadatha. That is based on the ras, the best chewing twigs can be stated as tikta rasatmak shreshta nimba, kashay rasatmak shreshta khadir, madhu rasatmak shreshta madhuk, and katu rasatmak shreshta karanj. Also, I would like to quote that the time of Danta Dhavan, Acharya Charak has mentioned that the Danta Dhavan Kal as Dvikalam Sayam Pratiriti. That is, we should follow Danta Dhavan twice a day, and it can be considered as early morning, and Sayankal can be considered after the post dinner. Also, the Acharya Bhagavad has given the same thing in the Ashtang Hridaya Sutra Sthan, Adhyay 2nd. My next point is on the Jiva Nirlekhan, the scraping of tongue. So why should we do the scraping of tongue on daily basis? The dirt deposited at the root of tongue obstructs the expiration and give rise to the foul smell, so the tongue should be scraped regularly. Tongue scrapers which should not be sharp-edged are and it should be curved and should be of metals like gold, silver, copper, tin, and brass. Or we can also use the soft twig of toothbrushes that can be made from leaves, and it also can be used. One should remember how to use the above materials gently and comfortably for the tongue scraping. The Acharyas have mentioned the ideal length for the Jiva Nirlekhan to be the 10 angles, that is the 10 fingers. Another reference for the benefits of the Jiva Nirlekhan can be found in the Ksham Kutahalam by the Ksham Sharma. It mentions that the Rasna Dantajar Oga Vairasyam Malasambhavaha na Bhavanti Mukhe Tena Vaishadyam Labhavam Bhavet. So Abho Sut explains that the Jiva Nirlekhan will remove the dirt, bad taste, and smell of tongue. The Gandush Kaval. The Gandush Kaval, it means the holding the medicated liquid or oil in the mouth gargles. So, Asancharya tuya matra Gandusha sa prakirtitah. That is, in Gandush, medicated fluid is held mouthful for a specific period until there is lacrimation or the nasal discharge. and then the patient splits it out. Sukham sancharyate yatu matrasa kavalah smrutah. That is, in kavalgraha, the mouth is only 3/4 or partially filled with the medicated fluid. The fluid is then swished in the mouth for a specific time and then spits out. The difference between the two is only the composition of the drugs, dosage, and the procedure of using the drugs. To conclude this, I would like to exclaim the benefits of the Gandush and Kaval as per mentioned in the Yoga Ratnakar, like Gandush Mathakurvita, Shite na Paisa Mugga, Kafatrushna Malaharam, Mukhanta Shuddhi Karanam, Sukhoshna the Gundusha, Kafaruchi Malapa, Danta Jadyaras Shapi, Mukalaga Karakam. That is, Gandush should be done repeatedly with cold water. It removes cough, Trushna, and Mal. And Gandush with warm water removes the kapha, aruchi, and strengthens teeth, promotes lightness in mouth.
Namaste. Further, I will continue with third hetu of justification, which is abhyanga. In 21st century, people are running behind wealth, not taking care of health. So to take care of health, abhyang, which is mentioned in Dinacharya. Why abhyang? स्नेह अभ्यंगम आदि यथा कुंभस्य चर्म स्नेह विमर्दनात् भवति उपंगात् अक्षक्ष दृढ़ क्लेश सयो यथा. According to Manusmriti, तेलादीना शिरः सहित देह मर्दनम. As advised by Acharya Vagbhat, one should perform abhyang daily. अभ्यंगम आचर्य नित्यम स जराश्रम वातः दृष्टि प्रसादः पुष्ट आयु स्वप्न सूतक ढाढरी कृत. If abhyang is not possible daily, then it is also mentioned by Acharya Vagbhat that Shirah Shravan Padeshu Tam Visheshan Shilyet. According to Acharya Charak, by doing Shiro Abhyang, one can prevent him herself from Shira Shula, Khalitya, Palitya, Kesh Pratapatti, rejuvenate Indriyas, increase skin complexion of face, Indriya Lava and Sukha. For Karn Puran, in Charak Samhita, it is mentioned that na Karn Roga Vatotha, na Manya Hanusangraha, na Uche Shrutir, na Badhir Sayan Nitya Karn Tarpanat. By practicing Pada Abhyang, it helps to remove Kharatva, Stabdata, Rakshyam, or Supti. It also makes the skin Sokumarya, provides Bala and Sthairya, improves Drishti, and pacify Vat. It also prevents disease like Gradashi, Padisputanam, and Shira Snayu Sankochah. Abhyang should be practiced daily. It wards old age, exertion, and aggression of a vata. Bestowed good vision, nourishment to the body, long life, good sleep, healthy skin. It should be done especially to the head, ear, and feet. Now, fourth hetu is Vyayam. According to Acharya Shishrut, Sarir Ayas Jananam Karma Vyayam Sangitam. The action which produces tiredness is Vyayam. According to Acharya Vagbhat, Vyayam is beneficial for all. Lagvan Karma Samarthyam Deepto Agni Medha Shayam Vivak Ghan Gatratam Vyayam Du Upajyate. One should do Vyayam half of their strength only. Arth Shaktya Nishivayastu Balivi Snigdha Bhojvi Shita Kale Vasante Che Mandam Ev Tato Anyada. Mild exercise or walking can be done if person is not able to do intense physical exercise. Moderate walking does not cause much trouble to the body, enhance lifespan, intelligence, digestive power, stimulated the sense organ. यतु चंक्रमण ना अतिदेह पीड़ाकरम भवेत तद आयु बल मेधा अग्निप्रदम इंद्रिय बोधनम. As per modern era, ACSM, American College of Sports Medicine, and AHA, American Heart Association, have recommended guidelines for the amount of physical activity that individuals should engage on a routine basis in order to maintain health and wellness. Adults should perform moderate intensity aerobic physical activity for a minimum of 30 minutes on 5 days in a week, or vigorous intensity aerobic activity for a minimum of 20 minutes on 3 days. Now, it's my fifth hetu, Nasya. In Ayurveda, head is considered as the most important part of the body. According to Ashtan Hridaya, Nasa hi Shirso Dwaram. According to Shishru Samhita, Aushadam Aushad Siddho Va Sneho Nashikabhyam Diyate Iti Nasya. In Dinacharya, Nashya can be practiced daily is Pratimarsh Nashya. प्रतिमर्शो भवेत स्नेहो निर्दोष उभयार्थ कृत. Pratimarsh nash can be practiced daily. The finger should be dipped in oil and drop should be instilled into the nostril. As the amount is only 2 drops, therefore it is devoid of any complication administered any time. For Pratimarsh nash, 14 kala are mentioned in Sushruta Samhita. Practices of nash at proper time, as shared in the text, prevent diseases of eyes, nose, and ear. Now, presently, Anutel is widely used, available, and accessible to all. So, it can be used for Pratimarsh nash because lightness of head, proper sleep and awakening, cure of disease, clarity of organs, pleasant mind. Use of nash in modern era. Today's environment is much polluted, and due to inhalation of polluted air, so many respiratory disease affects the society like congestion, allergies, chronic cough, rhinitis, various breathing problems. In chronic stage, it will develop COPD, asthma, and bronchitis. In Ayurveda, prevention of these burning problems can be made through nasya.
Good afternoon all. Now I am presenting some scientific evidences on Dinacharya. First study is on Brahmurat. There is a study to prove the relation between cortisol and immunity. It was conducted in March 1991. It shows physiological amount of cortisol, the chief glucocorticoid normally produced by human adrenal cortex, is necessary for the development and maintenance of normal immunity. Another study which shows the awakening cortisol response, it shows in healthy adult, salivary-free cortisol concentration increased by between 50 to 160% in the first 30 minutes immediately post-awakening. There is a study on Kaval, the effect of oil pulling with sesame oil on plague-induced gingivitis. It is a microbiological study. In this study, sesame oil is used for oil pulling, as it is known to have antioxidants, namely sesamin, sesamoline, and sesaminol. The mean plague score of group B declined from 1.60 to 1.39 after 45 days, amounting a reduction of 13.13% compared to initial score. The mean gingival index of group B declined from 1.26 to 1.01 after 45 days, amounting a reduction of 19.84% compared to initial score. The mean number of colonies in the case of group B declined from 37.1 into 10 is to the power 3 to 31.0 into 10 is to the power 3 after 45 days, amounting a reduction of 16.44 as compared to initial score. Now there is a study on Siro Abhyang. It shows the effect of scalp massage on stress hormone, blood pressure, and heart rate of healthy female. A scalp massage was conducted on female office workers, divided into 15-minute group and 25-minute group, only twice a week. And its effect on stress hormone, blood pressure, and heart rate was analyzed. Significant difference in norepinephrine, cortisol, and blood pressure were found in terms of interaction by time interval and between groups, as shown in the slide. That is the difference in statistical data pre-massage and post-massage. Next study that proves physical activity and exercise lower blood pressure in individuals with hypertension. It is a narrative view. The present review analyzed the scientific evidence for the blood lowering effect of aerobic physical activity in 27 randomized control studies on individuals with hypertension and shows that regular medium to high intensity aerobic activity reduced the BP by the mean of 11/5 mmHg. There is another study on physical activity advised only or structured exercise training and association with HbA1c level in type 2 diabetes. It is a systemic review and meta-analysis. It shows reduction in HbA1c by 0.89% in 150 minutes by doing 150 minutes of exercise per week. Now there is a study on Nashya, a comparative retrospective open label study of Ayurvedic medicine and their combination with allopathic drugs on asymptomatic and mildly symptomatic COVID-19 patients. The primary outcome of this study was the symptomatic relief from COVID-19. Data collected over a period of 2 months showed that more patients exhibited symptomatic relief in Ayur group, that is by 83.33%, than the yellow Ayur group, that is 48.78%, within the first 13 days of treatment, and no visible adverse effects were observed. There is another study that shows the efficacy of Nashya in coma patients. It is a case study which shows there is a difference in Glasgow coma scale in 2 sittings of 15 days from 3/15 to 11/15 in verbal response, motor response, and eye response after Nashya.
Practicing Dinacharya does not mean that we need to do everything at once overnight. Make journal list that we will need to make specific for ourselves. Find the area that we need to work with the most and make a list of what change we would to like to make. Start with 2 to 3 goals for the first month. Find some comfort in these, and then you can bring to add more at slow but steady pace. There is a need to develop SOP for Dinacharya according to Prakriti, creating awareness by incorporating social influencers like actors. There is a further scope for intervention study to analyze the health score before and after study to educate people about Dinacharya. There is a need, some programs are required, awareness for Dinacharyas. If folk don't want to engage in their normal activity, I have some words for them.
नगरी नगरस्य रथस्य एव रथि यथा स्वशरीरस्य मेघावी कृते यशिव वहितो भवेत्.
In order to achieve pleasure, one should choose method of life that do not conflict with religion's principle and commit themselves to peace and learning. One attain happiness. Thank you.
Thank you, Pratishthapana group, for putting forth your point. So how it is possible, right from Brahma Muhurta, you have told the importance of Brahma Muhurta and added the statement of Bhav Prakasha in having importance of light food, and also the oral hygiene, Jiva Nirlekhana, especially it is mentioned in Kshema Kutuhala, wrongly pronounced as Kshama Kutuhala. Okay. And then Gandusha Kavala importance. Along with this, you have mentioned many research articles. You looks like mere followers of the Aptopadesha as well as the proven research articles, whatever these days available. So Vyayama effect also you have mentioned on HEB A1C and Nasya, it's effective. So along with this, that they are telling that awareness programs also very less in this Ayurveda Dinacharya, their point is. So Pratishtapana try to prove their point, how the importance of Dinacharya is there in the present era. Okay. Now, moving with this second round, we'll have third round connected with this. We finished second round, which was much detailedly explained by 2 groups. However, there will be no involvement of Vitandavadins in the second group where your justification is needed. You are not to prove. You are not here to prove anything, any statement, but still in connection with these 2 rounds of Sthapana and Pratishtapana, we'll move to the third round, that is Jidnyasa. Okay, asking the queries against Sthapana and Pratishtapana. So let us start the queries. And after having queries from Sthapana, Pratishtapana as well as Vitandavadins, so we'll give chance to audience also, even YouTube viewers also. So all be ready with your questions. Let us give the chance to Vitandavadins since more than 1.5 hour, 1 hour they are keeping quiet. Okay, so we'll give the chance to Vitandavadins. So you ask your queries against Sthapana. What is wrong in their statement? Vitandavadins, go ahead.
For Sthapana,
Yes.
for Sthapana, in the present era, knowingly or unknowingly, people are following some of the Dinacharyas, right? For example, Snana and all. So how can you tell that Dinacharya is impossible in present era or not able to adopt Dinacharya?
One by one. We'll take one question, answer. One question, one answer. Okay. One, Snana, about Snana.
About
All are
Snana,
following
I'll talk.
Snana.
Yeah.
Okay.
Snana, doesn't mean just taking a shower. There are many types of snana. Okay, Surya snana, Godhuli snana, Mrut snana. Okay, the basic snana that was explained in Ayurveda Dinacharya was snana with the application of Mrit application, Mrit Pinda application. So nowadays people use soap. Who uses Mrit today? Anybody who uses Mrit? Mrit is collected from a river that is flowing throughout the year. A soft mud is collected and then it is purified. Then it is washed in a water. A fine paste is prepared. And while application of Mrit also there are mantras to be recited while application of Mrit. Simply merely taking a shower is not enough. While taking snana, it is to be thought of that as if Abhisheka is going to be done on the Lord. That kind of upasana has been mentioned in snana. Merely taking shower and applying chemically based soaps that are formed made up of chemicals, that doesn't make snana entirely. Doesn't complete the process of snana.
Okay, Stapna group telling that many people taking snana, not only one snana, but many snanas they are taking in routine. Is the point from Stapna. Okay, what is your next query?
What if the person is Nastic and he don't want to follow all these things? How can you?
That is why we say it is not possible.
No, but also he is doing Dinacharya, right? According that is Dinacharya, right?
Actually, I want to ask whether the contraindications of snan are followed. Vagbhat says snanamardita netrasya karana rogati sarishu admana pinasa ajirna bhuktavatsu cha garhitam. In ajirna pinasa adman, in every condition snan is done. Nobody knows, the public doesn't.
Also, I want your teammates to kindly look into our pratignya. We said Ayurvedokta Dinacharya. Ayurvedokta Dinacharya. Whatever Dinacharya that has been said in Ayurveda is not possible. Please make out the difference.
You said application of Mritika is Ayurvedokta Snana.
Sorry, could you
please said
repeat?
Application of Mritika. Okay. Nowadays, the rivers are contaminated, isn't it? Okay.
Not all.
Wait, let her finish the question. Okay. She is
Yeah.
done with
Yeah.
half of the statement.
Rivers are contaminated. Okay, you are saying Mritika also. Nowadays, they are doing for hygiene. Okay, all are not meant for adhyatma or any other thing. Okay, generalized for hygiene purpose also, they are doing snana. Nobody is doing. Nobody is doing for adhyatma purpose. What is your justification on this?
That is why we are telling that it is not possible in the present scenario. That is the exact
Then
reason.
you are telling hygiene is not important?
Hygiene is important, but they see applying.
How their question is how Mritika Snana is hygienic?
Mritika snana is hygienic in a way that
Am I-
it doesn't
am I right?
produce bad odor.
Okay.
I'm answering it. It doesn't. Once you apply snana using Mritika, after few hours, you won't feel smelly, even if you sweat it out, even if you sweat out by doing some works. When you apply chemical based soaps, you're literally applying chemicals. And after a few hours, if you work out or if you do something, if you start sweating, you start producing bad odors. You develop diseases. In skin diseases, doctors especially advise not to use soaps. Okay, that way Mritika Gairika itself is a very good medicine in Ayurveda. It is prescribed in many of the skin diseases. That way, Mritika Snana is far better. In fact, it's the best type of snana that is there.
What about the other peoples who are doing snana with the Haridra and other medications? They are practicing by birth. According to region, they are changed by different medication they are practicing. What about that?
I think you have not understood our pratidnya. It is adaptation of Dinacharya practices not possible. We are not saying that all these classical practices are possible for the general public. That is our pratidnya.
That is only I am asking. You are telling not possible. Those who are doing it, what is your justification on that? You are telling Mritika is good. What about Haridra? It is also a medicine.
See,
there are few.
Many general public are following these Dinacharyas. What are your views on this? How
Sir,
can you say
Haridra Snana is usually done during.
will not be a partial statement from your side
Sir,
to
let
say
me
that
answer.
it is difficult?
Yes, sir.
Even after knowing that many people are following Dinacharya.
Sir, Haridra Snana, as the opponent team member mentioned, it is practiced during festivals itself. That too, women practice Haridra Snana, not men.
Oh, it
Rarely
comes
practice during.
occasionally. It
It is
comes.
occasionally practiced, not as everyday routine.
It is not Dinacharya.
So, and it is not. It might be in practice in some very minute, very interior places or in villages. But the general public, when you consider the general public as it is mentioned in the title, it has not been practiced.
Okay.
Okay, you mentioned might. Some people are in rural areas, they are bathing with the Haridra and gram floor. Okay, no, but in some areas they are not at all knowing about soap itself. What about them?
We are in 2022. Everybody knows about soap. Everybody has a smartphone. Then how is it possible that people do not know
How
about
can you
soap?
quote everybody? There are some such
even-
areas are there where they don't know what is mobile and how to use mobile. They didn't even
because
see the
we
mobile.
because we use the term general public in our pratigna. Please understand what is meant by general public. General public, according to Cambridge Dictionary, it says general public are a group of people who doesn't even belong to any one group or one area, or who doesn't even have any particular knowledge or any special knowledge.
Okay, general public includes only includes some people, whether they are present in the world, and if your definition is not holds good in that, you are not considering those people who are living in the world.
We are speaking as a whole. We are not targeting any one group of population. We are speaking as a whole. Maybe this rural and urban, we can have it in a separate debate.
Okay, but you are mentioning for some people, for your it is right, for other people, those who are practicing, what about them? You are not considering
No,
those
they are practicing.
statements?
See, in our Drishtanta we mentioned Andhenaiva Niyamana Yathandyatha. That means they are thinking that they are practicing, but they are not actually practicing, because just taking a bath and coming out of the bathroom, that doesn't mean they are practicing snana. It has a very deeper meaning to it. Okay, talking about smartphones, if there are no smartphones available in some interior places, in some rural places, then that can be considered as tribal community. Okay, so they do not come when we look at the larger picture, considering the general public in current scenario, that is the present era that we are living in. So almost everybody uses soaps, showers, shower-based gels.
Okay.
So,
We
snana.
had enough bath on the word snana now. Okay, we'll move to next question. Leave the snana. Next.
As you told, like nowadays people are using social media, mobile and all. And also you mentioned that it is the swabhava and prabhava. Why can't we do prabhava as we, why can't we promote our dinacharya through social media and all? It is possible, right?
Okay, being Ayurvedist, how we should deny this? Promoting the Ayurvedokta Dinacharya is our responsibility. And how can we go away from this?
First, I would like to add that the topic itself, what we are debating is it practically applicable? We are not saying that are we going to promote it? Of course, if we are going to promote, some demography of the people can accept it, cannot accept it. But in the current scenario, is it accepted? Or in the current scenario, is it generally applicable to it? So we cannot say that in the future tense that if we might do this, it might happen. We are debating over the topic itself is that it is practically applicable or not in present scenario.
Adding to it, if it should be promoted, it should have been in practice by now. How many years has it been since smartphones have arrived in our lives? Smartphones have taken over our lives. It should have been practiced by now, right? If
Hope
that
is
was a
a-
possibility, it should have been seen in practice by now.
Hope and prayatna is everything, right? We can do one move. It can be practiced in other
Yeah, but the
eras
topic is
and
current
other-
scenario. Current scenario.
Current scenario also. Now also some people are coming to Ayurveda, and foreigners also like adopting Ayurveda and try to follow it. By promoting only this is happened. How you can say that it is not happening?
Actually, there was a survey done on a techno group in which early risers versus night owls were examined. And in that, it was seen people who are habituated to sleep late at night were asked to get up early in the morning for one day. And 65% of the people couldn't adapt to this new change. So it means you can't just promote it through the smartphones. It is a practice. it has to be done, and it will come in when they will start practicing it and when they will start adopting it. This new generation that we belong to, it is very hard for them
Stick to
to adopt.
Dinacharyas. Stick to Dinacharyas. Okay. Not to
So it is
smartphones.
related to Brahme Muhurta, sir.
No, yeah. Smartphones are coming in scene much. Okay. Dinacharya. Concentrate on Dinacharya. Okay. Vitandavadins, you have time.
You also told like nowadays people are not having time. Hardly it will take 2 minutes to take pratimarshanasya, right? And we don't have any contraindication for a pratimarshanasya. So you can adopt these things at in present era, right?
Can you repeat the question?
In present era, they told like time is not there for practicing dinacharya.
Okay.
We mentioned in our drishtanta about time factor. We mentioned that time has a psychological meaning to it, as quoted by Bananje Govinda Panditacharya. It has a psychological meaning to it. It means not interested. Like I have time, I have got a lot of time, but I'm interested in browsing through my smartphone than performing nasya, than taking in nasya. So that is the issue in the current scenario among the general public. They have got a lot of time, but their priorities are different, as mentioned by Shukacharya in Bhagavata Puranam. So there is time, but the priorities are different among the general public.
As you are talking about general public, knowing the psychology and different types of dharmas and other thing is necessary. Practicing is important rather than knowing these things.
Yeah, it is nitya. Ayurveda is nitya. Ayurveda has dharmacharana, dharmartha kama mokshanam. It is nitya, it is necessary.
No, without practicing, how it becomes nitya is the question here.
You are only supporting your pratigna.
It is nitya, but it is not practiced. It is nitya in nature, but it is not seen in the general public. That is the
They are
statement.
telling other bhava svabhava nityatvacha. Okay. Likewise, they are telling. Okay, not in practice. Okay. Next question, Vitandavadins. I think they have taken enough time to ask the question against Sthapana. We'll stop the queries of Vitandavadins against Sthapana. I will move on to the queries of Pratishthapana against Sthapana. Pratishthapana, what all doubts you have against the Sthapana group? It is time to clear the doubts now. Ask your doubts against Sthapana, and in return you will also have doubts.
You said that Ayurveda is Nitya. Then why we can't follow it in Kali Yuga?
That is what we told Yuge. Sattva guna has been decreasing. Though we are at the Sandhikala of Kali Yuga, the discipline that used to be seen during the ancient days, during our olden days, it is disappearing in the present scenario. Present scenario, we are influenced by the Westerners. We want to imitate. How many of us know to speak Sanskrit here? Are we speaking? In olden days, speaking Sanskrit itself develops samskara in individuals, it is said. So the samskara among the individuals is decreasing in there is no discipline in among the general public in present scenario, because they want to earn their daily bread. They want to go about doing their jobs, their professions. Earning money is the only intention in the present scenario. Not many people are they want to, only when they're affected, they visit hospitals. We usually see that people are coming to Ayurveda hospitals after trying everything, after trying all of the conventional methods of treatment. Yeah, chronic disease.
Sattva doesn't finishes in the early era of Kali Yuga. It will be finished in the end of Kali Yuga.
Yeah, Acharya Charaka has mentioned that the guna, sattva guna, is going to decrease from yuga to yuga.
No, is it a clarification or a doubt?
I'm just
No.
No, you are giving clarification.
She told that in Kali Yuga, Sattva Guna will be decreased, and that's why we can't follow.
Yeah, you have given clarification.
I'm telling that it is not completely finished.
Okay.
Yeah,
In
it
the
is not.
Kali Yuga,
That's what. It is going to decrease. It is going. This situation is going to become worse. This situation, the current scenario, what we are witnessing now, this exact situation is going to become worse by tenfolds, by multifolds. It is going to become worse. That is how praliyate, jagat praliyate, as mentioned by Acharya Charaka. That is why we want to wait for the Dashavatara of Vishnu. That the Kali nature, that is the Tamasika nature, is going to increase. That is mentioned in Charaka Vimanasthana, 3rd chapter, Janapadodvamsa Adhyaya. It is going to increase to its toppest level, and then there is going to be pralaya. So
Okay.
this scenario is going to
By
continue.
these all, the Dinacharya practice is not possible, they are telling. What is your next doubt?
How can you justify the plastic toothbrush is not a major health concern and to the environment?
Can you just repeat the
How,
question?
how can you tell that plastic toothbrush is health beneficial to you?
Yes.
How come you say that
Justify the use of
plastic
plastic
toothbrush?
that it is not a major health concern and to us and also to the environment.
It is a major health
Yes,
concern.
yes, but
That is what we are telling.
no,
How is the question now?
no, but you told na that it is not entirely possible.
I am telling like,
but we are practicing it. We are doing pragyaprad. We know that we are causing the harm to the environment.
Yes.
But still, the point of your
What is your question?
My question is that how can you justify that currently what we are using that plastic toothbrush? We are practicing it from a
Yes,
long
we are
time.
practicing plastic toothbrush. Yes.
So how can we? How can you justify like that? It is right.
It is not right. I didn't tell, I never mentioned like using plastic toothbrush is good, because it is already mentioned like almost 600 million kg of waste we are generating by just by using plastic toothbrush.
Yes, exactly.
But compare like at present scenario me, what we can adopt is like usage of Twix, right? But because of deforestation, because of IUCN red listing of the Twix, and because the acharyas have mentioned like supujita desham, richva granthi, all those dimensions has been mentioned, that is also not possible to get it. Can you identify all the drugs which I have put in the slide?
Yeah, exactly. The people are not aware about the
People
things.
are not
Yes, so
available,
we
aware
can do
of
that,
that.
the awareness. We can work on that. We can
At
create awareness.
present scenario matlab, which is existing scenario में you yourself like you accepted that people are not aware of the drugs.
In present scenario, do you make plastic toothbrush of your own?
Why should I make of my own?
That's why I'm telling that Ayurveda people will make the that Ayurvedic twig.
People will make the plastic toothpaste.
No, they will make the tree twig and will be marketed for the common people. They don't have to go and pick up the twig from the tree directly.
Presently it is there.
What?
Presently is there. It is there.
Yes, I can show. I have shared in the slides.
In marketed. So are you sure that they are collecting it from Supujita Desham without any Rajva Granthi and all those, and not only just selection of twigs, we also have to Aveksha, Rutumcha, Doshamcha, Rasamcha, Viryam. So all these things we have to assess before taking the toothbrush. So before using the twigs. So are you sure that people are aware of the doshas, Ritu and all? At least like Ayurveda community, can they tell at present what is the Ritu we are in?
So those people who are collecting, they are also Ayurvedic physicians, and for marketing and all, the company are also doing standardization of that thing.
And one more thing is that it should be collected freshly. That is also mentioned.
Yes.
Freshly collected twigs. So is that possible in the present scenario?
But it is not necessary that we follow Ayurveda as it is told in text. We can.
Our pratikya is Ayurvedokta Dinacharya.
Yes, but
So our
we can practice Dinacharya with some modifications in present era.
That is not
possible.
Dinacharya. That we cannot accept as Ayurvedokta Dinacharya. Dinacharya, whatever mentioned in the classics, only that we can accept as Dinacharya.
We are not denying to follow Dinacharya, but we are like, we should not deviate from the core knowledge that we should do brush with a Ayurvedic twig.
As already mentioned, we have a very large list of how should we chew, how should we select, how should we do the Dantadavana and all. Then you are telling just brushing the teeth is Dantadavana. That is not possible. And just by brushing the teeth, I cannot accept that it is Ayurvedic.
They are telling there is a difference between brushing the teeth with toothpaste and Danta Davana is different.
So are you agreed that we should use the modernized toothpaste?
We are not anyway, we don't promote any market or we should
No,
use this for
modernized
users.
paste, Ayurveda paste.
So are you accepting that you should not do toothbrush?
See,
you
what
stand
I
you are
stand
not
for
doing
is,
toothbrush even with a modernized toothpaste. You are not
I'll just
accepting this also.
explain
Then what should you do?
I stand for is, at the present scenario, whatever Dantadavanam Acharyas has mentioned, that is not possible to adopt. That is what I'm standing for.
But we can adapt now
Then please
by
tell me how can we
customization, by standardization of that thing.
Which
Even
standard,
like even from apart from this discussion, if medicines are being sold of Ayurveda in company, like we have to collect the medicine from a Prashasta Desha. It is not possible from current era. But medicine
that is the
manufacturing.
topic at present. The
Only
topic
only
is-
questions. Only questions we take from you. Okay. Question. Next question.
So what are the questions like people are following Dincharya in village area or any other area? Like I am doing Danta Dhavan Gandusha. So should I not do Gandusha according
You
to
say
you?
that you are the representative of a general public.
No,
except
I am
one
not
person
a
saying-
general public representative, but I am a general public.
Yeah, you are a part of it. But to actually preach and propagate the use of Danta Dhavan, which includes these twigs, which are kashayaras, which is not palatable to whole the general public, and then doing Danta Mardana as well, which requires this whole like charya requires at least 10 minutes, and the common public who are dedicating minimum, I guess, 20 to 30 seconds to brushing. Can we say that the general public will accept this?
At least general public can use Katutik Kashaya Dravya Pradhanadar.
General public
to do?
cannot even identify which is the which is which twig.
That's what I'm
If
telling.
you,
They don't
that is
need
why it
to
is impossible.
identify.
If I bring some twigs before you and show you, can you identify which is Kakubha?
They
which
don't
is
need to
Karachi?
identify. They are not making their own toothbrush. They are taking it from market that are already available.
Twigs are available in market.
Yes,
Yeah, every day it should be collected freshly.
they can be preserved.
So Katu Tikta Kashaya should be there, but it is not there presently in the market.
Okay. Sir, time. Over. Pratishtapna. Your queries.
I would like to conclude by saying that the general public.
No. You can conclude later. Okay.
No one's questions.
Now the chance is to Vitandavadins against Pratishtapna. Pratishtapna, you be ready for the statements, whatever you have given in the first round as well as in the justification. We go with the Vitandavadins. How it is not possible. Okay, they are telling that it is possible. What are your doubts, queries on Pratishtapna group? Vitandavadins on Pratishtapna.
Yeah, we shall be presenting our questions to the Pratishtapana group. So the first question being, your team has mentioned that Diva Swapna is advised for those who do Ratri Jagarana, not the Acharyas. You have told in the while presenting. So isn't it against the principle of Swasthya as it leads to Kapha Vriddhi? How would you substantiate your statement?
In Shrushu Sharisthana 4th chapter of 30th shloka, it is told that Ratravapi Jagritvan Jagritika La Ardha Ishamte Diva Swapnam.
Exception.
Shrushu
case is
Samhita
there.
Sharirsthan 4th chapter 30th verse.
It is exception. Okay.
Yeah,
If a person is doing regularly, like doctors are doing regular Ratri Jagran, watchmen are doing Ratri Jagran, so they are advised to do Diva Swapna for Ardha Kala.
Yeah, but that will negate your statement of Brahmi Murta
I'm
Uttishta.
not telling you should not wake up in Brahma Muhurat. I'm just telling how to overcome that Diva
Yeah, but
Swapna.
every day,
that
it's not
Ratri
like a doctor will have one night duty or the security or anyone. So they will have a continuous call for night duty or the night shifts. So how can you substantiate that? So Brahmi Muhurt is not even followed by them. So your entire
No,
pratigna of that
her
statement
question
is
is the one who is having night duties. Okay, his night duties becomes day duty and day duty becomes night duty. Okay, so in day he sleeps and in night he become aware or awake.
And I want to conclude this by, as the Dincharya we told, it is depends on our surroundings. If a person is doing IT sector work, continuously light will be in front of him.
No,
He will
question
not feel
should be
any
thrown from
Ratri.
this side. Okay, you
I'm
should ask
explaining.
the question. You should answer the question.
I'm explaining it.
Okay. Continue if at all you are answering the question.
So I was explaining that if a IT sector person is doing IT work in front of light continuously, so for him it will never be Ratri. Okay, it will never be Ratri for that person. So it will disturb his circadian cycle, disturb his melatonin and serotonin. So as you are telling, for that regularizing, we have to do Ardha Swapna, Ardha Kala Diva Swapna to regularize that.
Yeah, you're right about that. But what about him following the Dinacharya? The first step being Brahmi Murti Uttishte Swapno Rakshartam
Swasthya
Aisha.
Rakshartam
Okay, so
Aisha.
the first and foremost protocol mentioned by all acharyas is not followed by him or her. Okay, and it's not a small population, not only India, even if you consider the entire worldwide, it's not just a small population which does have a night shift or night calls or night duties or complete jobs who have a night profession. So how would Dinacharya be implied to those people?
Next question. Next question. Next.
Next, the Abhyanga references that you gave. So you mostly mentioned the benefits of Abhyanga. So all are definitely right, but how would you implement it on a daily basis for the general public? That was not clear.
I explained already, like those persons who have time to do Abhyanga.
Sorry?
Those persons who have time to do Abhyanga, and second condition is those who don't have time to do Abhyanga. First, I will explain those who have time to do Abhyanga. They should be educated about the proper way to use Abhyanga. Like there are two types of Abhyanga. First is therapeutic, like we do in Panchkarma for 15 minutes as they have told. But we are not doing for Panchkarma purposes. We are doing for Dincharya purpose. And they can do Abhyanga for short duration of time, as they told, like they don't have time for that. So for them, Abhyanga should be done like Shira Shravan Padeshu Tam Visheshana Shilet, as is told. So at least they can do that. And if they don't,
is different from our people doing it. They're not doing it. How many population actually follows the proper protocol of Abhyanga daily? Dinacharya is to be done daily. That is the main protocol. So are people doing it daily?
all peoples are not doing. That's why we have to spread awareness program and all.
Spreading awareness is a different issue. You can spread awareness from tomorrow or maybe after the debate, but that's not the point. The point is the present people doing it? No.
Present people don't do, and we can't do
Exactly,
anything.
they don't do it. So are you going against your pratigna, saying that it's
Pratigna,
acceptable?
okay, be aware of that. Okay, people are not doing. This is a fact. No one can change it.
So
Okay.
people are
But
not
it
doing
is possible.
So you are
For our ideas,
including that
we have to do
practical applicability of Dinacharya is not possible?
What?
You just said people are not doing it.
Yes.
So you just negated your own pratigna.
This is a factor they don't follow, but we have to make them follow by spreading awareness, creating
Spreading
standard operating
awareness is
procedures.
right, sir, definitely, but not now.
See, the pratigna is, it is whether it is possible or it is not possible.
Yeah, your
Okay.
team member just
Yes.
mentioned it is not possible.
No, he didn't mention that.
It's not
See,
being
we are
doing
not-
it.
We can't change the fact that people are doing or not doing. But we are discussing here the matter that if it is possible or not.
So is it happening now? No.
We all know that can I speak in Hindi a few times?
Okay. Proceed.
Yeah, like मैं खुद उतना practice नहीं कर पाती हूँ. Not entirely I can do that. ठीक है, like we were talking about the abhyang. Like we can't practice abhyang 15 minutes or 10 minutes or 5 minutes. But Shirapad and Karna abhyang, that is mentioned by the Acharya also, and general public also practice. But they don't know that it comes under the Dincharya. Like Shirabhyang, like we do champis, है ना? Like we do champi, like oil massage. That can be considered as Shirabhyang. Okay. Then the second point, Padabhyang. Padabhyang, like daily we can do it, and some people do practice that. See, the point is that we can do it.
The point is exactly we can do it, but people are not doing it.
See, I am not standing here to prove the fact that these people are doing and these people are not doing. I am here to represent that if it is possible or not possible.
So
we can.
What is it? What is your pratigna? It's possible or not?
It is possible. I am saying it is possible.
But why aren't people doing it then? Present scenario, the general public is not doing it.
People are not aware about the Dincharya.
So awareness is another totally other topic.
Yes, it is total, but the people are not following it because there is, मतलब अभी नहीं कर रहे क्योंकि उनको अभी से पता नहीं था. But अभी हम उनको
तो आप मानते हैं कि अभी नहीं कर रहे, प्रेजेंट सिनेरियो नहीं कर रहे.
Not entirely. हमारा अब समझ में नहीं आ रहा आपको, शायद कि हमारा पॉइंट ये है कि पॉसिबल है या नहीं.
Let me repeat you the pratigya first. Adaptation of Dincharya practices are possible in present scenario. Whether it is practice or not, it is not our topic. It is possible or not. How it is possible, I am explaining
possible?
that. Okay.
So you can tell how is it possible?
Telling how it is possible. If they don't have time, then they should do at least it on weekends. On Sundays.
It is not
They should do
Dinacharya.
Shira
They
Shravan
said
Padeshu
it's
Tam Vishesh
Dinacharya.
Shirye. They should do at
Weekends,
Shira
not
Shravan and
Dinacharya.
Pada.
Then it becomes Saptaha Charya. Okay. Not Dinacharya.
Dine
is the point.
Dinacharya is
Yeah.
Dinacharya, right? How can you substantiate only for the weekends is Dinacharya?
Changes didn't come from one day. We have to make him Satmiya. From 1 day, then 3 day, then 7 day.
So you're talking about the future. We have to is a future tense, not the present scenarios, and
But it is possible. This
not
is
in
what-
present scenario.
Okay, possible is from their side and it is not followed in the present scenario is your point. Okay, next question.
Is it okay that some of the people will follow the sum of Dinacharya? Then do you consider it as a Dinacharya? Like if person is not following all the Dinacharya. Do you consider
Okay,
it as Dinacharya?
if at all not followed the Ayurveda Ukta Dinacharya, is it not the Dinacharya? A little tricky is. Okay.
What is Dinacharya? The activities that are followed in day or night, like Dinacharya and Ratricharya is explained in Samhitas. So any activity that is followed in daytime, that is included in Dinacharya. So whether we can follow all the activities or some as per convenience that come under Dinacharya. So we can say Dinacharya can be followed.
I'm asking that there are many rules and regulation we should follow.
Last question against Pratishtapana.
You said activities are considered as Dinacharya. Here we are talking about Ayurvedokta Dinacharya. If a person sit in a one place, you consider it as Dinacharya?
Sorry, we can't get your question.
You said that daily activities are considered as Dinacharya, isn't it? So if a person sit in a place, in a day, do you consider it as Dinacharya?
Okay. Being passive is also action. Okay. Is it also? It is also Charya.
No, like you are asking about sedentary lifestyle.
No, I am not asking about your statement. I am contradicting your statement. That's it. You only told like this that daily activities is considered as Dinacharya. If a person is sit in a place, that is you consider it as Dinacharya?
No.
How can you contradict your own statement?
It is said Dinacharya is Dinacharya.
That is only in your teammate has told like it will start from if 3 days, 2 days like that. They gave option also whether 3 days, 2 days also considered as Dinacharya. Whatever whenever they want they can do Dinacharya.
If someone is not able to follow exact Dinacharya as said, we can follow it on as per convenience. Like for some it is possible on weekends, for some it is possible in
Dinacharya is for according to their convenience or it is for daily basis.
It is to keep ourselves healthy.
Okay, but why the term is mentioned as Dinacharya? It can be considered as Swasthya. In Swasthya only they mentioned, no. What is the reason of Dinacharya? What is the word meaning in that text? You only quoted that term and quoted that shloka.
Yes,
How can you substantiate like this?
If someone follows Dinacharya on daily basis, definitely he can keep himself healthy. But if he cannot follow regularly, to some extent he can keep himself healthy. Not completely, but to some extent he can prevent himself from diseases.
Okay, for some you telling in weekends we can do like that your statement is. But if the person is doing Dinacharya in a wrong way or in a wrong avastha, what your statement on this?
For that we have to create awareness among
For
public.
everything
Yes.
you are creating awareness. You are coming for awareness also. We are talking about present scenario.
Being Ayurveda professionals, it's our duty to create awareness, to educate people.
Whether you are educating people, what are the modalities of educating the people? Can you substantiate that? How can you educate the people?
Yes, we can create standard operative procedures. We can add curriculum activities in schools. We can add these things from primary level so that even children can inculcate into their habits on daily basis. We can create all these camps and activities in daily basis.
Okay. Oh, you told for schools. Those who are illiterate, what about them?
Last question.
Those who are illiterate, what about them?
Those who are illiterate.
Illiterate people,
Yes.
what about them?
For them, we
Uneducated.
can organize free camps.
By free camp, you educate the illiterate?
Yes, to educate.
First you educate them, then you told about, you will tell about Dinacharya. This is the manner you will educate the people.
Okay. Stop. Enough debate on this. by Vitandavadins against Pratishtapana. Okay, as the dharma is reduced, its pada, okay, in Kali Yuga. The same is with Dinacharya, they are telling. Saptahat. Dinacharya is been shifted to weekend, is the point partially from the Pratishtapana group. Okay, let us take this debate to next stage, that is the queries of Sthapana against Pratishtapana. What are your doubts?
Sir, you stated that the first charya, Brahme Muhurte Utthishtet Swasthораkshartham Ayusha, right? Is it possible? That is what your statement was, right? That was your statement, right? Yes.
Be confident on your statement, okay.
Yes, it's possible, right? Please tell me the time of today's Brahma Muhurta Kala. Please tell me the time of today's Brahma Muhurta Kala. I want the exact time of today's Brahma Muhurta.
See, पहली बात तो ये कि उसमें SOPs अभी तक क्रिएट नहीं की गई है, ठीक है? And we need to study the climate and weather also, because of the season.
So if you don't know the
sunrise and everything,
SOPs, how are you going to fix the time and wake up at Brahma Muhurta?
Just open your mobile now and search.
No, I want you to answer.
I am saying na, just open on your mobile and search for sunrise today.
Okay, for SOPs,
and do
we'll ask
48
Sun,
minutes
we'll
minus
ask
from that.
Surya
This is
Deva
the
to create.
Brahma Muhurat of today.
Pratishtapana,
Okay.
wait for a minute.
One second.
Wait for a minute. To make awareness, we should be in a practice of that the same.
We'll ask
They are asking the question that what is today's Brahma Muhurta?
Muhurta Kala.
Just
You
explain
can't
that.
say SOPs for it. Should we have to ask Sun God to create his own SOP and give it to us?
Okay.
SOPs for it, SOP to know Brahma Muhurta.
See, right at this point, I am asking you, if you say that SOPs are not there, this is not there, this is not there, how is it possible? With this, I am saying that it is not possible. See, the first point itself it becomes very difficult. How to calculate it? And of course, to my knowledge, there are different panchangas existing. From my place, even there are 2 panchangas that are followed, and that carries the time differences here and there. So which panchanga to follow based on the Suryodaya? There itself occurs so much of differences. And how can you say that Brahma Muhurta we can calculate and we can wake up? It's practically not possible.
Yes, we can calculate what is the Brahma
Yes.
Muhurat today in Belagavi. Just search in your mobile what is
That
the
is what
sun.
I wanted you
Just
to tell.
listen to me first. The Brahma Muhurat can be calculated as just see the timing of today's sunrise in Belagavi minus 48 minutes, that is first Muhurat. You will get the Brahma Muhurat timing for today. So easy.
Okay, next question. Sthapana against Pratishtapana.
In your presentation, you have mentioned like preparation of toothpaste of Katutikta Rasa for usage. Can you just tell me what is the base they will be using in a toothpaste?
No. You are asking the base of the toothpaste
Yes.
of modern era.
Yes.
Well, they are
Because
not.
you mentioned that
Okay.
we can use toothpaste. So that is why I'm asking, what is the base of a toothpaste?
They can
mentioned
answer
based on
about
the rest.
Katutikta Kashaya, and they are not follower of toothbrush, I guess.
Okay, I'll itself mention.
Okay.
But this is a topic of research that can be amplified.
See, usually toothpaste will be having sodium benzoate and saccharin as their base. So in that case, you are asking the patient to take toothpaste, which is made up of sodium benzoate and saccharin, right? And sodium benzoate, it is proven that it causes oxidative stress in the brain. And the saccharin also, it causes an increased risk for obesity and all. So in that case, you are telling the patient to take something, not a patient, you are asking the public to take something which causes diseases in their future. Is that called as Dinacharya?
No, I am not telling to use sodium benzoate.
No,
or any
it is your pratidya. No. Listen, you are indirectly doing pratidya hani of your own. Okay. Be aware of it.
Yes, you are saying that
Next
you should use Katutik Kashaya Dravya toothpaste. So you are doing your own pratigya.
You ask about Katutikta Kashaya, they will tell the answer.
No, sir. What I'm telling is in present scenario, he mentioned that we can go with the toothpaste. And that is according to Dinacharya. What I am telling is that usage of toothpaste is never a part of Dinacharya.
That is what they are telling.
Sir, you didn't
Your
understand.
Pratigya Hani.
What we are telling is Ayurvedokta Dinacharya mein the usage of toothpaste will not come.
Okay, you please
But they are
convey
telling
them.
like
Okay, they are the answers. Okay.
Okay, I know the modernized toothpaste containing the pesticides and gluten, fluoride, saccharin, SLS, abrasive, collagen, pebbles,
yeah,
glycose,
that is
and
okay.
artificial
We
sweeteners.
have a long
All
list.
those have side effects on our diet, and majority of them cause cancer. But I am telling that for a stable toothpaste to make that Katutik Kashaya Dravya, research has to be done by our own. So
What
that to go to that,
like the Dinacharya,
so that make it
your
convenience for the
topic is
general
like
public.
presently it is adoptable, right? Dinacharya is
possible.
adoptable. So there you have mentioned about the toothpaste. That is what I asked. Mentioning of toothpaste or adapting toothpaste as a Dinacharya, that doesn't mean Ayurvedokta Dinacharya. But Ayurveda toothpaste also have a base like, sir, Ayurveda
Okay,
toothpaste is also
okay.
made
You
of
debate.
sodium
Okay,
benzene,
please, debater, you debate with the
Not
participants.
making toothpaste by making sodium benzoate. We can add
Next
that.
question. Next question. Stapna against Pradesh Stapna.
WHO has given a common guideline for physical activity, and when coming about to Vyayam rules, they have said that there is difference in Ardha Shakti Vyayam related to Shita and Vasant Ritu, and Manda Vyayam related to other Ritu. How do you justify the differences, and can you say it is scientific?
Can you repeat the question, please?
Okay, do you want? WHO has given a general common guideline for the physical activity that is to be followed entire year. But while talking about the Vyayam rules, in our Acharyas has said that Ardha Shakti Vyayam is to be done in Shishir and Vasant Ritu, and the Mand Vyayam has to be done in other Ritu. Then how can you say that it is a justific practices where WHO has given a common guideline for an entire year?
First of all, I want to ask you the WHO guideline Vyayama for exercise. What is it includes?
WHO has given a physical activity for
What kind of physical activities?
For adult, they have specifically mentioned that for moderate activity, it should be 150 to 300 minutes of moderate intensity activity. And for rigorous, it should be, I guess, it should be 70 to 150 minutes of rigorous activity in a week.
So you are telling that an obese patient of weight 100 kg should do the same exercise with a 50 kg person?
This is a WHO guideline.
That's why I'm questioning the WHO.
Yeah,
That,
no,
are you reading it the complete way?
what I asked. Did you understand what I asked?
There are some exception in that.
Yeah, you are saying, no, there are certain exceptions in that. This
is not
my
the
question-
complete
My question is
study.
related to Vyayam that has been said in our Acharyas. Understood that Mand Vyayam and Ardha Shakti Vyayam. How do you justify it?
Ardha
It is
Shakti Vyayama is, their features are told.
And that
Manda
Ardha
Vyayama-
Shakti Vyayam is to be done only in Shishir and Vasant Ritu. What about Grishma Ritu? Where there's a prevalence of diabetes, are we saying that in Grishma Ritu you are not supposed to do
For Grishma Ritu, Acharya is told Manda Meva Tatomyada. Manda
that? Yes,
Vyayama.
exactly. WHO guideline has been similar for entire year. And in Grishma, are you saying we are not supposed to do that?
But as an Ayurveda student, I will follow Apta Vachan of my Acharya, not for the WHO.
We are talking about general public. I would like to repeat, we are talking about general
They are
public where there's a prevalence
they
of
are-
diabetes.
They are
And
directly telling Stapna members. I interrupt Stapna members. They are telling that directly they are not influenced by the WHO guidelines. They
Okay,
are
we'll come to
influenced
it. We'll
only
come to
by
Aptavachan.
Ayurvedokta Dinacharya.
Yeah, coming to it.
Next
So there was a lot of big talk on awareness, like general public is not aware. So we Ayurveda doctors are aware of Dinacharya practices, right? Everybody agree? You are aware? Of course, we are in a debate, we are aware of it. Everybody is aware of Ahara Vidhi Vidhana also, right? So when we came here before the debate, we had nice meal, nice lunch was organized for us, thanks to the institution. So all of us were wearing our slippers, Padatra Dharana, while having meals, right? All of us used the cutlery, we use spoons, right? So we are aware of it and we are not following it. How do you justify that? Ayurveda doctors are aware of it. And we ourselves, in this very hall, all of us are wearing slippers, right? All of us are wearing shoes and we are discussing. We're talking on Shastra. We are talking about Shastra. So we ourselves are not following Dinacharya rules. Ahara Vidhi Vidhana, how to be Sadvrita. We are being aware, awareness. Yeah. And about Danda and Chhatradharana. Yeah. Being aware. Yeah. Being aware of it. We are not following.
Where is the Danda?
Where is Danda and Chhatra is the question.
Should have brought easy.
And then there were one more, adding to it, you said some, even following some of the dinacharyas can also be considered because general public are following at least some dinacharyas. But if
No, keep
people.
it as a question.
Okay.
Question.
You first answer. Okay, we'll come to it next.
Ma'am, there is one word like युगानुरूप रूपांतर. Okay, अभी हमारे यहाँ ऐसे छप्पर नहीं डले, like that used to be in that times. Okay, that when it was written, they had like it was a need of that time to use danda.
No, there is the concept of bhuta in Ayurveda. So, okay, it is a tantra. Chatradharana is to ward off the bhutas, negative energy, negative forces, padatra dharana and chatradharana. It is not only because of the sun.
Enough discussion. The questions, queries taken from Stapna against Pratishthapana. Now the queries, if at all queries are there, there should not be any query against Vitandavadins since they are wrangler. Okay. Any questions against Vitandavadins? Stapna? Pratishthapana?
You want to ask the Vitandavadis what is their stand? Whether they are for Dinacharya or
What is
against
your
Dinacharya?
stand? What is your stand? Possible or not possible?
We are not at all supporting both the teams. We are neither support the Stapana or Pratishthapana. We are not at all telling it is possible, it is not possible.
So this whole debate was of no use for you then.
It is for Tattva. Our role is that.
On behalf of audience, I will ask one question. What is your Dinacharya?
Sir, I will follow Brahmi Muhurta, sir. I will follow Brahmi Muhurta.
Then you are partially supporting one team?
No, sir.
Brahma Muhurti is the
Because I am not
statement.
following
Okay.
every Dinacharya, so I will not consider it as a Dinacharya.
Okay, partially you are.
No, I am not supporting any of the team.
Hmm.
Here they are talking about like present scenario at the whatever the things they are told. For
No,
that,
in brief, you tell your Dinacharya.
sir, as a Vitandavadi, whatever may be my Dinacharya, my role is to contradict both the teams.
Okay.
So that is my role here. So I am doing that.
Vitandavadis, they are playing their role. Okay, fantastic. Okay, now we'll take audience queries. Audience, okay. We'll take queries from audience and specify that which team you are going to ask the question. Please raise your hand whoever is ready to ask the queries against the maximum 3 questions we'll take from audience.
Good evening, sir. I have a query for the Pratishthapana group.
Pratishthapana. Okay. Query from audience.
Sir, I want to ask, like after we wake up in the Brahma Muhurta, then they have given some regulations for Danta Dhavana, like the twig should be Dvadashanguli and all, and it should be freshly collected. So is that possible, sir? Like in every day, it can be possible on Sunday, sir, but but sir, on regular days when we have colleges, the doctors have duties, and other general public also have their works. Is that possible that we take some arka and then we count Dvadashanguli each?
No. You are asking much time to collect the twigs or
No, sir.
you are
like,
telling it is difficult?
After collecting the twigs, is there much time to like Dvadashanguli? Then it should be
The classical reference what she is quoting, whether that is possible or not. How much inch the twig you collected today?
As I already told, you don't have to go to pick up the twig. As in modern era, in a Belgavi, if you can't see any Arkudumbar Negrod Khadira tree, then you can't take the twig. But I am telling that it should be preserved and to be sold in the market.
Okay, when you
and
don't
can
have time, you
directly
should
take it
preserve.
of
We have
12
fridge,
Angula and all.
fridge and all, no?
Yes.
Okay. Next.
And
Any
sir, I also have another 2 doubts.
two?
To Pratishthapana group only,
Okay.
sir. And sir, like even if there are no twigs, can we use a paste of Trijataka, Trikatu, Trifala, making a total paste and then applying it daily?
Yes, if Ayurvedic pastes are available in market, we can use it. And if we prevent ourselves from those preservatives that are used in toothpaste, we can use either churn, also told in Samhitas. So we can use churn. There is no need to invest our time. to daily collect churna from everywhere. We can keep it with ourselves and we can use that.
Yes, thank you, ma'am.
As Rishus Acharya has told that Trikatu, Trifala, Kushtachurn and Trijat with Saindav Namak can be used as a Dantamanjal.
Okay, okay. Thank you, doctor. Please, please take your seat. We have many questions to take
Sir,
from
another
other
doubt is
end.
there.
Okay, we'll give chance at the end. Okay.
Sir, in Dinacharya.
Hello, Pranjali. Please be seated. Okay, thank you. Next, I request Dr. Santosh Wallis, who is party, okay, online, who has joined virtually. He has some doubt and he will ask the question. And please, sir, specify what is your doubt against which team you are going to ask. Please specify. Dr. Santosh, sir. Hello? Sir, am I audible? Dr. Santosh, sir? Okay, till then we'll take the queries. Okay, queries are there. Okay, we'll take queries from no, not balcony here. Okay. Dr. Vishwabasu. Okay. Please keep it very short so that they can answer very easily. Okay.
Srimatre Namaha. Namaste to all. My question is besides the today related, but to the Sthapana, Pratistapana or Vitandavada. And Sthapana team has said that according to Ayurveda Dinacharya, it is not possible the Dinacharya in current scenario. Then the Ayurvedokta Vachana, with our which our Ayurveda says, Swastasya Swastarakshanam Matrasya Vikara Prashamanam. Where is the swastha? How we should or how we can raksha? How we can protect our health? We are not following the
Means the
Dinacharya.
provision of two objectivity, that is swastasya swastarakshan maturasya vikara prashamanancha. So if swastha vritta is not followed in terms of Dinacharya, then how the objectivity of Ayurveda are reached?
Yeah. So the topic was it is not possible in the current scenario. The answer to your question is change the scenario, change the way of living. We should change our lifestyle, the way we are living. Once we change ourselves, then it will be possible. So the answer is we should change.
Then
Change the scenario.
Can we modify the Dinacharya?
Okay, it is the same question by Dr. Deepanjali Jadhav as well as Kallanna Gaudar online who are joined you.
Yes, sir, definitely. Actually, that is what we have listed as the three major points in our Hetu in our Pancharya
Can we
Vyakya.
modify Dinacharya according to you? Can we modify?
Yes,
Is the
sir,
question.
we can.
Yes.
According to the present era, yes, we can modify Dinacharya.
Okay. The present need is little
Where
different.
there is no borderline to be drawn to Ayurveda. So, like, you cannot draw a border, like, this is Ayurveda, once you step out of this.
Okay, okay. Enough answer. I'll give chance to balcony. Who is raising hand? Okay. Okay, doctor, you can ask the question. We'll take the question.
Good evening, everyone. A question was there for Sthapana group, but just recently they have told that we can follow Dinacharya by modifying it. So I wanted to previously ask that if many movements have come, like TKDL they are using, like Haridra they have used, Neem they have used in foreign countries. As soon as they begin to use in suitable form, we claim that it is already explained in our science and whatnot. But when we say that we can modify and use by ourselves, you say that this is not classically explained in Ayurveda. This is not the deeper meaning. This is not the intention. But all the shastras you apply and you say that this is not we follow in Ayurveda. But when they follow in what according to the basic need of them, you say that it is already given in us. You cannot say both of them. We should accept that according to the present day we can modify, and even now we can follow
She's
Ayurveda.
telling, her opinion rather than a mere question. Okay. Done.
Thank you.
So I think somebody has. Okay, Dr. Yukta. Okay, you can ask the question. Please hand over the mic. Against whom you first tell, then ask the question. Dr. Santosh sir, if
Okay, my question is to Team Pratisthapana. You said that you are following the pratigna that it is possible in the current scenario, right? So you have the awareness, being the doctor, Ayurvedic doctors, and you are saying it is possible. So are you yourself practicing it daily on a daily basis?
I won't say complete Dinacharya we follow on daily basis, but to some extent, as much as possible, we follow it. I personally follow Brahma Muhurat, Vyayam. There are certain Dinacharya activities that I follow.
But you're not following exactly the same as written in Ayurveda.
But we can follow with some modifications.
You are waiting for the Western world to patent it, then you should follow from them, or you should follow from now.
So my question is, are you yourself following, not about myself? You are following it or not?
We are following it partially, to be true.
So basically, it's complete following is not possible in current scenario.
No, I'm not saying for all. I'm telling it by personally.
okay, you should lead from the front as a group. Okay, leader. No individual statements here. You are stating from the group of Pratisthapana. Okay, done.
So shouldn't you lead by example for the entire world, for the general public?
Okay, this is a big question for Pratisthapana. Can you be an ideal personality for following the Dinacharya and make a SOP on this? Please give the answer.
Yes, we should be the ideal for others, and we should practice Dinacharya as to our extent.
You should. Are you doing it?
I told
My
you earlier.
question is present scenario, not in the future and after 2 years, 3 years, 10
Dr.
years.
Yukta Sharma, they are following partially and they are going to make the awareness among the public in next coming days. Okay, thank you. Thank you, thank you. Last question. Okay. Last question.
My question is to Sthapna group. You said we can modify the Dinacharya, then it will be against the Apta Vakyas. Then should we follow it or not?
Okay. What about Apta Vachana, Aptopadesha, Aptastu Yathartha Vakta?
The Dinacharya, if you go through the chapters, rather than reading just the slokas, if you go through the entire Tika of Arunadatta and Hemadri, there are only specifications laid down only for few charyas. Say, for example, for Brahma Muhurta, it said Swastha Purusha, Swastho Rakshartam Ayusha. Rest of the charyas are made in such a way that everybody can follow or specific people can follow. That is why in the subsequent adhyayas, like for Nasya, Dhumapana, Kavala, Gandusha, there will be few indications and contraindications. So based on that, selectively under which roof you fall, you can follow that charya.
Then if we follow some activities like Brahma Muhurta Uttishta, then Vyayama, Abhyanga, then it will be considered as Dinacharya or not?
Can you repeat your question?
If we follow some activities in Dinacharya like Brahma Muhurta Uttishta, Nasya, Danta Davana and Abhyanga Vyayama, then it will considered as Dinacharya or not?
Of course it is considered, but if you select it based on your Prakriti, Desha, Kala and everything.
Then it is possible now. We can follow Dinacharya in present era.
Only if I said if you know. If you know, it is possible.
Thank you.
Okay, thank you audience for bringing the queries against Sthapna, Pratisthapana and Vichandavadins. So now we'll give pause for a debate. Now I request Dr. Shivkumar Harti sir, today's expert of this session. Dr. Shivkumar Harti sir. Sir, am I audible sir? Sir,
Yeah.
you have listened to the debaters' debate. Please analyze the debaters' debate through your expertise opinion on this today's debate, sir. Over
Yes,
to
thank you.
Harti,
Yeah.
sir.
Thank you very much, Prabhakar. Since last 2 hours we have kept our fingers crossed. It was a very good debate, scientific debate. Every team performed it very well. I'd like to congratulate them before giving my expert comments. It was a wonderful debate competition. So when it comes to my opinion, so sarvamanne parityajaha shariram anupalayat tat abhave hi bhavanam sarva bhava sharinam. That is, everyone should give more importance to health, because in its absence there is nothing else. So all the human beings should excel towards, should always, yell towards excellent health. But if you look at today's scenario, one of the publications from Indian Journal of Medical Research says that the military people Indian military people who are supposed to be the most healthiest people, there was a survey conducted among them by S. Rain Kulkarni, one of the studies conducted, where they said that 80% of the people were high prevalent for pre-hypertension. So about 67% had liver abnormalities. 30% had overweight obesities. So when we see this study, the population which is expected to be most healthiest one, they are also more prone for communicable diseases. Now there are many reasons for this. Since last 50 to 60 years, there has been a lot of lifestyle transition. There has been transition in the physical activity pattern. Initially, people used to go, most of the people used to go for agriculture occupation. But today, we have shifted it to some other one. We have sedentary lifestyle, we have offices, computers, IT industries. So there is a lot of transition in the physical activity. Am I audible?
Yes, sir. You are audible, sir. Please continue, sir.
There has also been a transition in the diet and nutrition pattern. If you could see the diet and nutrition, what our forefathers had, and today the diet and nutrition, what we have in our home is entirely different. We have today more ready-to-eat foods in our lifestyle today. And it's not even that, even there has been a demographic shift of the people. For example, myself, I belong to North Karnataka, but today I'm still settled in Delhi. So there has been entirely shift in the lifestyle transition of the people. That is why we are seeing a increase in the prevalence of non-communicable disease, and of course even infectious disease. The COVID-19 was an example for that. So to overcome all this, what the acharyas have told to follow, that has to be it's very ideal one. Dinacharya, Nishacharyam, Rutucharyam, Yatoditam. So these Dinacharya, Nishacharya, Rutucharya have to be followed. So if you see, look into Dinacharya practices, may not be practiced, but at least the practicable things can be practiced daily. And we have been seeing a changing attitude among the people regarding wellness. We could see that since the COVID era, many people started using Nase in their home. Many people started using Ayush Kwath in their home. Many people, immunomodulators market was a big hit in that period. So people today are more prone, are more aware of a wellness products. If you look into wellness and beauty industry, it is one of the fastest growing industries in India. The market, which was around 101 billion in 2012, and today it is around 550 billion to 550 billion. So even the functional food market is innovation driven and has been dominated by multinational companies. Ayurveda forms the basis of these functional food products which are sold in Indian market. So today there are many startup companies. For example, today there are many startup companies who sell neem sticks for Dantadavan. One of the students was debating that, do we get neem sticks? Do we need to go to collect the neem sticks? Not go to collect the neem sticks. Today there are many companies, there are many startups who sell neem sticks. Even you could say that there are combs which are made from neem sticks. So we, the fraternity of Ayurveda people, should be more aware of these entrepreneurship actually. We see that government is promoting a lot of ecosystem of startups. We should use this opportunity of ecosystem of startups to create innovative, more wellness products and bring it to the market. And even the government is giving special focus on the industry when it is Make in India campaign. The only thing is the spotlight is on the expansion and spreading awareness. We also debate that we have been moving towards a Western lifestyle. But when you talk about Western lifestyle, one of the survey, Euromonitor Internet survey says that today there are 37% of the consumers, Western consumers, who are actively monitoring what they eat to manage their weight. 32 people consumers, they have tried to limit the intake of bread, pastas, and other carbohydrate-rich foods. And 20% of the people are already on diet trying to lose weight. If you look into the global fitness market, yoga is the most lucrative one. In America, it is said that the yoga industry almost doubled from 2016 to 2022. There are around 36 million yogis. I mean, people who perform yoga right time in America. I mean, look at the global market, there are 300 people. And the survey also tells that the yoga market is around $80 billion worldwide. So the wellness industry is booming. It is up to the people of us Ayurveda how we convince the people the scientificity of these Dinacharya practices and develop the awareness of healthy living, which include Dinacharya, Rutucharya, Sadvrata, etc. Even Ministry of Ayush under the leadership of our Honorable Prime Minister Narendra Modi have taken a step to reach Ayurveda to every house every day. That's why the theme of this year for Ayurveda Day is Har Din Har Ghar Ayurveda. And if you look into the recent happenings, the Union Cabinet has approved the inclusion of Ayush Health and Wellness Centers in National Ayush Mission. Now, under this program, the Ayush Health Wellness Centers, they would be operating under NAM. They would be having an objective to establish a holistic wellness model with Ayush principles, and with more focusing on preventive, promotive, curative, rehabilitative, and palliative healthcare. And one more objective is to spread the awareness of lifestyle, yoga, and medicinal plants. So these are all the things which have been, even the government is trying to do a lot to spread the awareness of the Indian system of medicine. But one thing is that these lifestyle prescriptions should be protocol driven. Today, everyone has got a different lifestyle. So before advising anyone lifestyle, we need to study the person's prakriti. We need to study the person's lifestyle and diet patterns. Based on these only, the lifestyle patterns, that is Dinacharya, Ritucharya practices, should be tailored or modulated. Then, if you could, if you could do this, then we can consider ourselves a very successful people. And these practices can be practiced by a larger population and lead to a healthier nation. So with these few words, I would like to conclude. Thank you. Thank you very much.
Thank you, sir. Thank you so much. Sarvamanya Paritejya Shariram Anupalayeti is the statement given by expert of today's session, respected Dr. Shiv Kumar Harti, sir. So I thank wholeheartedly for being connected with this program and judging the debater's debate.
Yeah.
Thank you, sir.
Prabhakar,
Thank you
I'd
so
also
much.
like to thank the organizers, Professor Suha Shetty, sir, the management of KLE for giving an opportunity to interact with you all. Thank you. Thank you, one and all.
Thank you so much, sir. Thank you. Now, after having listened to the expert opinion on this today's debaters debate, now I request respected Dr. Prashant A.S. Principal, sir, Ayurveda Mahavidyalaya, Hubli, to speak a few words on this today's debate. Sir, am I audible, sir?
Yes, sir. Yes, sir.
Yes, sir. Please, sir. Please go ahead, sir.
Yeah. So, respected Dr. Suhas Kumar Shetty, the principal of KLABM Ayurveda Mahavidyalaya, Belgaum, Dr. Savita, the coordinator of this event, and I'm very much pleased that from the Rajiv Gandhi University of Health Sciences, our Ayurveda Mahavidyalaya Hubli, then from the KLE deemed university, that is BMK Ayurveda Mahavidyalaya Belgaum, the most reputed and prestigious institution, and from the Mahatma Gandhi Wardha University, the Ayurveda Medical College. So from the three universities, three institutions are chosen, and an inter-university competition, rather, and a healthy discussion has been made in the Ayur world. Definitely, this is a kind of a motivation among the young scholars of Ayurveda, postgraduates, PhD scholars, internists, also attracting the BMS graduates, and conducting such types of Vada, Jalpa, Bitanda, and Sambhasha Parishat. The basic concepts of Ayurveda is served, wherein the Adhyayana, Adhyapana, and the methodology of teaching goes in Ayurveda accordingly. It is not defending, it is always for Vada, people having the equal qualification, persons having the equal knowledge and personality, they are invited. So, KL has done a wonderful job in this regard, conducting the Samvada, wherein the Vada is made between three groups. However, such kind of different orientation programs and motivational talks, even in-depth going into the Ayurveda Shastra. For example, the Government of India, Ministry of Ayush has chosen Har Ghar Har Din Ayurveda. Definitely there is a need of the hour where Ayurveda should reach to the public and society. Every child in the house need to speak few aspects of Ayurveda. The mother who takes care about the child also starts speaking about Ayurveda and different various issues of Ayurveda. Definitely the globalization of Ayurveda will happen. So I am very much delighted that this particular event today in the afternoon at KLA Belgaum has been organized very well, and always the organizing committee is used to be in touch with our institution. It is not only our institution motivating our postgraduates, the participants, and giving lots of guidelines, even online also. In future endeavor, we definitely promise that our institution will also organize such events, and we will give an opportunity to participate the young postgraduates, researchers, and others. So thank you. Thank you.
Thank you, respected Dr. Prashant A.S. sir, for your valuable words on the debaters' debate and putting forth your opinion in this hall virtually and highlighting on Jnanopaya Margas, that is Adhyayana, Adhyapana and Tadvidya Sambhasha and their importance. Thank you so much, sir.
Thank you, sir.
Thank you, sir. Next, I request, I think, respected Dr. Vaishali Kuchewar, Dean, Mahatma Gandhi Ayurveda College Hospital. She is not joined virtually.
Yeah, thank you, sir. Am
Yes,
I
yes,
audible?
madam. Sorry, madam. Madam,
Yeah, am I audible, sir?
so on behalf of our organization committee, I would like to request to speak few words on this today's debaters debate. Madam,
Yeah,
over to you, madam.
Thank you, sir. Am I audible?
Yes, madam, you are audible, madam.
Yeah. So first of all, I would like to thank and congratulate Dr. Suhas Kumar Shetty sir for organizing such a very different event, Samvad 4, and it definitely helped all of us and specifically students to think on the Dinacharya and whether really it is possible or not. And I also would like to congratulate all the teams because they have, I think with this theme, they have collect lot of information, lot of researches, and it is very important to all of us. And we all knew about the various types of researches done on the Dinacharya and Ritucharya. And I would like to congratulate specifically the team of KLE, means your team, as they were very confident that it is very impossible to follow this Dinacharya, and I think they are the very important means what we can say it as a means they will definitely make aware the people about Ayurveda, as their confidence was reflecting that they can do the big awareness of Ayurveda, that we can do the best Ayurveda practice, because they are so much confident. Your team was very confident, I feel. And the Pratisthapana team, they have also collected a very scientific evidences how can we practice. And the Vitandava team was also very good. They have raised a very good questions. And it was really a very different and a novel event which was organized by your team. Thanks a lot, sir, for giving giving us this opportunity to send our team to this event. Thanks a lot. Thank you very much. Thanks a lot.
Thank you so much, madam. Respected Dr. Vaishali Kuchewar, Dean, Mahatma Gandhi Ayurveda College. Yes, madam, it is the all three team members responsibility equally to take the responsibility of Dinacharya. Yes, we are part of debating for and against, but equally our responsibility is to promote Ayurveda guidelines for general public. We take your words, sir. Thank you, madam, for your valuable opinion on this today's debate. Thank you, ma'am. Now, moving on to next program, that is Margadarshakanam Abhiprayah. Okay. Now we'll take the opinions of mentors. Okay, Dr. Rajkumar, sir, please. Dr. Rajkumar, sir, from Mahatma Gandhi Ayurveda College Hospital and Research Center, Wardha.
Om Sri Dhanvantaraya Namaha. Sarvebhyah Namaskaraha. A very good evening to all. First of all, I would like to say thanks from the bottom of my heart to the KLE faculty and KLE principal sir and management, and my dean, Dr. Vaishali Kuchevara, for providing this wonderful opportunity to take part in this wonderful event, 4th Samvada. And coming to the present topic, today's topic, adaptation of Dinacharya practices are possible in the present scenario for general public. It's a quite interesting topic. And this sort of discussions are essential for postgraduate curriculum and undergraduate curriculum, because these sort of discussions enhances our thinking ability. Your means thought-provoking. It's like a thought-provoking, and how we have to behave with the society, and how we have to analyze the subject, how we have to understand the subject, how it has to be delivered to the common people. So these sort of programs to be encouraged. I thank Dr. B.S. Prasad sir for starting this or initiating this program, wonderful event. So coming to today's topic, all the three teams are shown their competitive spirit very well. In this context, I would like to put forth my opinions, focusing on what way we can overcome these lacunas or shortfalls for the following of Ayurveda Shastrokta Dinacharya. So there are some ambiguous topics like Brahmi Muhurte Uttishta. What is Brahmi Muhurta? Jirna Ajirna Lakshan Apeksha. Means what are the Jirna Lakshanas, what are the Ajirna Lakshanas? How can you ascertain, how can you explain for the general public? And Ashtaprasruta Ushapana, quantity of water we have to take in the context of Usha Jalapana. And Danta Davana Kashta, according to age, according to Prakriti, we have to make available. And Jihva Nirlekhana, the length of Jihva Nirlekhana, it has been mentioned, but according to age, it is not mentioned. And dosage of Pratimarshanasya, it is mentioned 2 drops. In the another context, it has to be reached from the nasal passage to Asya Kuhara. That is the ideal quantity. So these ambiguous things to be avoided. So these these controversies can be avoided by focus group discussions. Focus group discussion will develop the robust content. And coming to the oral hygiene, Danta Dhavana has been mentioned, Jihva Nirlekhana has been mentioned, Kavala Gandusha is also mentioned. So as per present scenario, this fast and furious life, which has to be adopted. And in the context of Vyayama, Artha Shakti has been mentioned. So these are inaccessible to the common man. So these to be making available means they can easily understood what is Artha Shakti, how, in what, up to what time we have to do Vyayama. So these can be developed, these lacunas can be overcome by the focus group discussions by developing robust content. And Dinacharya practices can be enhanced by customization and tailored made approach. Why? Because Dinacharya has its own importance. Ajatanam vikaranam anutpattikaram chayat. Before starting the swastha vrutta, before starting the daily regimen, Acharya Charaka clearly stated that Ajatanam vikaranam anutpattikaram chayat. It shows the Dinacharya has its essential role in the prevention of our upcoming diseases, lifestyle diseases. And at the end of swastha vrutta, at the end of Matrashiti Adhyaya, it is clearly stated that Nagari Nagarasyeva Rathasyeva Rathiyatha. Swasharirasya medhavi krutyeshu avahito bhavet. Swasharirasya medhavi. Those who want to protect their body from the upcoming diseases. Like he has used two analogies, two drushtantas. Nagari Nagarasyeva. A mayor, how a mayor protects his city. And another example, Rathasyeva Radhiyatha. The charioteer, in what way he protects his chariot from the enemies. In the same way, those who are protect their health or prevent or preserve their health, they have to follow what have been mentioned under the Swastha Vrutta and under the Matrashitiya Adhyaya. And if you go through the style of presentation from Charaka to Bhavaprakash and Yogaratnakara, Charaka has started with the Anjana. And Vagbhata started with the Brahmi Muhurta Uttishta. And Vagbhata, Bhavaprakasha has also included Bhojana Vidhi and Ratricharya also. Whereas Yogaratnakara has also included Ratricharya in the description of Dinacharya. So it clearly indicates they are also followed the Yuganurupa Adhunikarna, Yuganurupa Rupantrikarna. According to age, according to generation, they have also followed the daily regimen. They have felt that this is essential for the present generation. So in that way, we have also, we can modify the Dinacharya according to the present generation, but without deviating the core themes. What is the purpose? What is the deeper meaning of that particular Dinacharya aspect? And what about, if we follow these, what about this social media and whatever the gadgets, whatever the mobile phones, how can we withdraw from these aspects, withdraw from the gadgets? So it is clearly mentioned we have to follow Sattva Vajaya Chikitsa. What is the theme of Sattva Vajaya Chikitsa? Ahitebhyo ardhebhyo mano nigraha. You have to protect yourself, which is ahita. You have to protect yourself. You have to keep away from the ahita arthas. You have to preserve your indriyas from the ahita arthas. And another principle you can use, abhyasa satmya or oka satmya. In one day you cannot follow everything. So you have to adopt day to day, day by day, day by day. You can change you can adopt the Ayurveda Shastrakta Dinacharya. So with this, I am conclude, and I am thankful to Dr. Suhas Shetty sir for giving this opportunity, and thankful to KLE Society. Thank you.
Thank you, sir. Thank you for your valuable opinion. Now we'll move to take the opinion of the second Margadarshaka, that is Dr. Shruti ma'am, Shruti B. Joshi. Ma'am, please.
Shubha Sandhya to one and all. Respected B.S. Prasad sir, President Board of Ayurveda, NCISM, New Delhi. Dr. Suhas Kumar Shetty sir, Principal, KLE Ayurveda Mahavidyalaya, Belagavi. Dr. Shivkumar Hatti sir, Associate Professor, Department of Swastha Vritta, All India Institute of Ayurveda, New Delhi. And respected Principal sir, AMV Ayurvedalaya, Hubli. And respected Kucheva ma'am, Wardha, Mahatma Gandhi Ayurveda Vidyalaya. And respected all the staff, teaching staff. And my dear student friends. So, first of all, I want to congratulate the organizing team of the institute, KLE BMK Ayurveda Mahavidyalaya, and each participant of the 3 groups for the wonderful debate session. Acharya Charaka quoted that, and also our Pratisthapana group, it mentioned, Tachanityam prayunjita swasthyam enanuvartayet ajatanam vikaranam anutpatti karam chayat. So by following Dinacharya, one can have the normal benefits of the health in possible two ways. So one is Kshiyamana Dhatu Poshana. By the dhatus which are under the process of dearrangement or destruction get nourished. And second one is Swasthya Vighataka Hetu Tyaga. So it keeps away the factors that are harmful to the normal health of an individual. It is said in Mahabharata, Kalo va karanam rajnyo, raja va kala karanam, itite samshayo mahu, raja kalasya karanam. So if a question arises, whether king is responsible for surrounding situation or time is responsible, then the answer is undoubtedly king is responsible for surrounding happenings. So it is possible here by the word king, we all have been addressed. Common general public is addressed. So it is possible to adopt Dinacharya in present scenario with little modification wherever it is required, wherever it is needed, without changing the original tattva of the Ayurveda, original flavor of the Ayurveda. And one more thing I want to quote, it was from Sthapana group, they mentioned, Ananda Tirtha Bhagavat Padacharya, Madhvacharya, a dear doctor, she said, she put Swabhava, she put an sentence, it's two kinds, Swabhava and Prabhava. So I would say, and let us hope, Swabhava of Tattva or benefits of Ayurveda should dominate the Prabhava of modernity. Right? So with these words, it was indeed a wonderful session, scientific debate session with lots of takeaway messages. And such samvadas are wholeheartedly welcomed in future too. With these words, on behalf of Ayurveda Mahavidyalaya, I thank the organizing institute for the opportunity given. Thank you, one and all.
Thank you, ma'am. Dr. Shruti B. Joshi from Ayurveda Mahavidyalaya for enlightening words. Now we move to have the opinion of Dr. Praveen Birdi, sir, who is a mentor for KLE Ayurveda Medical Mahavidyalaya.
A very good evening to one and all. Respected dignitaries of the dais and on the dais, my dear students. First of all, I would like to congratulate all the participants, our college students and Mahatma Gandhi College students and Ayurveda Mahavidyalaya, Hubli College students, along with all the mentors. So everything already explained by all the experts and principal sirs and also mentors. Okay, just I will conclude it within the 2 minutes with which point we have to explore in the particular debate and which all are the points that are lagging behind and all. Just I will focus on that point only. It could be helpful in the upcoming event also. So first of all, in the Sthapana group, they explained in that Dinacharya for healthy and the disease, in between the questions comes, okay, whether it is a healthy, swasthya or a disease. And the term next comes is Dine Dine Charya and all. Okay, so the Charya, you already know that meaning. And the Dine Dine means what? Whether it is applicable for swasthya and deceased. So in disease, they are given some examples, and swastha, they are given some examples and all. Okay, they can consider it as with the help of Tantra Yuktis and all, which is called as Adhikarana and all. They could have explore that particular help with the Tantra Yukti. That could be a more apt for this debate, I think so. So you could be done better in the upcoming events and all. Okay, so next, coming to the Pratisthapana and all, they done a good job with all the contents and everything. They collected, I think they highly appreciated for collecting the more information research works and all. Okay, so congratulations once again. So in that small lagging means the only thing is awareness is frequently we heard that. Okay, so the question is by the Sthapana, they asked the question as, even though aware person is there, okay, being a doctor is also aware persons, how many they are practicing? Okay, leave about the awareness program and all, how many are practicing that? That is also one question. They could have given more examples with the research background, everything. They could have an answer also. That is one point. And other than that, everything is presented with all the research work. That is a highly appreciated thing. Okay. So next, coming to the Vitandavada, I congratulate with Vitandavadas also. Anyhow, there only one statement they stated that neither for nor against. Okay. That is what this to be a safer side. Okay, so this is what they explained about, but they given with all the documents and all. And even though they put forth the questions against the Stapana also and the Pratistapana also, they framed the very good structure of the questionnaire and all. Highly appreciated for the questionnaire and all. All the best for the upcoming events also. And what sir said in the Harti sir, that is her din and her gar. Okay, so that is nothing but we should practice day by day itself only. Okay, and one more quote is there in the Charaka also, and some of the first year students also there here. They might have studied in the first year itself. That is called as Satata Abhyasanaham Sheelanam. Okay, so when you practice day by day, then only it will be adopt. Okay, otherwise if you practice in the weekly base, okay, that will be like a not adapt in the proper way. So it should be called as Satata Sheelanam, that is Abhyasanam Sheela. Okay, if you practice daily means automatically it will come day. Some of the persons in the rural also there, without alarm also they will wake up. Okay, so that scenarios are there. In some of the urban areas, after alarm also they will not wake up. Okay, such a scenarios also there. So it is left to us how we'll adopt that. That's what the called as title is adaptation. Okay, so whether it is implemented in the current scenario or not. Okay, so other than that, everything is good. I think we are celebrating Dasara also. Okay, almost in the stage, Nari Shakti is there. Okay, so highly appreciated for that. Almost 2 boys are only there. Yes, behind every woman, there will be a successful men's also there. We'll consider both the two. Okay, yes. With this, once again, I congratulations to all the participants and the mentors. And the mentor from Hubli College, she was my classmate only. After 10 years, I met her. Okay, so once again, I thankful to all the coordinators and our department. And especially, I would like to thank Suhas Kumar Shetty sir giving me the opportunity to as a mentor for the Stapana group and all. So hope for the upcoming events also. This is the first time we are conducting in a hybrid mode, and I am highly appreciated that all are involved very good, and this will be a grand success also as per me. And that is credit goes to all the students. That is nothing but participants also, and the mentors especially, and our UG and the PG students also. I highly appreciated for this event for the grand success. And thank you to the Harti sir given the opinions also, and the principals from the Hubli College, and also for Mahatma Gandhi Ayurveda College also. I once again congratulate, and I'll once again thank you to the one and all. Thank you.
Thank you, sir, for your comments on the today's debate. So before having the presidential speech by Dr. Respected Suhas Kumar Shetty, sir, I request our beloved principal sir to come on the dais to distribute the certificate. For this, I would like to request the Stapna members to come one by one, or as a group you come and receive the certificate one by one. Big clap for Stapna group for actively involving in this today's debate. Participants, PG participants from KLE Ayurveda Mahavidyalaya, Belagavi. They debated for the topic. Now next, Pratishthapana group, Mahatma Gandhi Ayurveda Mahavidyalaya, Wardha, Maharashtra. So I request our principal sir to give away the certificates. Participants, please receive the certificate one by one. Big clap for Pratishtapana, Wardha College. Now third team is Vitandavadins, Ayurveda Mahavidyalaya Hubli. I request team members to collect their certificate from our beloved principal, Dr. Suhas Kumar Shetty. Big clap for Ayurveda Mahavidyalaya. Applaud with claps. Now it's time to give the certificates for mentors. I would like to request Dr. Rajkumar sir, Ayurveda Mahavidyalaya Vardha, to receive the certificate. Guided in time, leaving his other works aside, guided for his team, Pratishthabana. Thank you so much, sir. I would like to request Dr. Shruti B. Joshi ma'am, mentor, Ayurveda Mahavidyalaya Hubli, for guiding their students and making them very stronger to wrangle with two groups, that is against Sthapana and Pratishthabana. Thank you so much, ma'am. Now, finally, our young and enthusiastic staff, Dr. Praveen Birdi, sir, to receive the certificate for his mentorship program. Okay. I would also like to request Dr. Savita B. Patshetty, ma'am, HOD, Department of Basic Principle, to organizing this wonderful event and making this event successful.
सम्प्रति कार्यक्रमस्य निर्वाहकाः आसन् अस्माकं विभागस्य अध्यापकः डॉक्टर प्रभाकर हेगडे वर्याः। तान् अहं प्रार्थयामि प्रमाणपत्रं स्वीकुर्वन्तु इति।
Now I would like to request Dr. Prashant Gaonkar sir, who is anchor in Sanskrit for today's debate. Thank you, sir, for being connected with the Sanskrit language, always with us. Thank you so much. Now I would like to request our beloved principal, Dr. Suhas Kumar Shetty sir, to give his presidential speech.
A very good evening to all of you. Warm greetings from Keli Academy of Higher Education and Research and Sri B.M. Kankanwadi Ayurveda Mahavidyalaya Belagavi. The event, which really started as an institutional program, gained its momentum to become a state-level program, went on to become a national-level program, and now, as rightly mentioned by Dr. Prashant sir, has become an inter-university program. And not only that, this program will become a global program in the month of December by being a part of the World Ayurveda Congress. I was with the chairman of the NCISM, Dr. Dev Pujari sir, a couple of days back, and he just said that you have been doing a wonderful program called as Samvada, and this program will definitely be initiated in different capacities, and one of such initiative will be that it will be a part of the event in World Ayurveda Congress. So this is a type of initiation that was possible by the visionary, the former principal of this institution and the present president of Board of Ayurveda of NCISM New Delhi, Dr. B.S. Prasad, who really initiated this particular event, and which was really popular, has become a very event which is talked by every faculties and students of Ayurveda. I really appreciate each one of you for being a part of this very innovative program. And as you know that we were in the online mode for the last 3 national online Samvada program. We just thought probably we should come to the hybrid mode and maybe exclusively then going for a offline mode. So with this intention, we have now started this particular offline mode. I'd like to thank all the 3 institutions, both especially the visiting institution from Mahatma Gandhi Ayurveda Mahavidyalaya Varda, as well as Ayurveda Mahavidyalaya Hubli, both Dr. Prashant Ayat sir and Kuchevar madam, for accepting our invitation and sending the team to our institution. We are very thankful to all of them. In fact, we are very thankful to Dr. Shivkumar Harti, who has accepted an invitation and who was an expert of today's program, who has enlightened us the importance of Dinacharya and how it could be adopted to the practice in daily routine. So we'd like to thank Dr. Harti for accepting our invitation and being a part of this particular program. Very importantly, like all the these 15 stars who are the limelight of today's program, really, I could really see their enthusiasm, their preparedness, their involvement. We just thought that they will really start fighting inside on the stage. See, that's the type of the environment that that should happen. Not fighting on the stage, but definitely have that competitive spirit in any competition. And I'm sure such type of activities, and that's a whole pattern of the curriculum that has been developed by NCSM now, where there is a lot of importance for the non-lecturing events. And this such type of debates are one such event which definitely will create or ignite the passion of learning by the students. So I would like to once again especially appreciate the Department of Basic Principles of our institution headed by Dr. Savita, Dr. Prabhakar, Dr. Praveen, and Dr. Prashant for taking a lot of interest. I think they were really working very hard for the last 1 month in organizing this particular program. And that too, when we thought that we'll have this program, initially we thought we'll have inside our campus, but then we thought that platform would not be sufficient enough to host this mega event. So we just decided that we'll have in our university campus, and we're very really delighted to have this at our campus of university, and really appreciate the entire team of Basic Principles for making this event very, very wonderful and memorable. I think one very important team who really needs appreciation at this moment is our IT team. I think the entire setup, the web hosting and the whole program, even each and every point that they have taken a lot of care, and even just as you are preparing for the topic, they were preparing for the event. I really appreciate each one of the member of this IT team, and this was really possible. This was really able to reach in every corner of the world because of their commitment and the involvement that they had. My high appreciation to the entire team. So coming to the topic which was really selected, and we had made a big list of the topics, and we were able to cut down to few of the topics, and then probably we thought that this is the most apt topic that we could have for this event, and that is that adaptation of Dinacharya practices are not possible in the current scenario for general public. See, there is a current scenario, there is general public. See, that is what probably we have to come out as a movement. I think this was like as Prime Minister Modi had come with the Swachhta Bharat. So that has become a real big movement, and really it has transformed into the entire generation from the pediatrics to geriatrics. Any age group will always be emphasized. Similarly, we should have a movement of Ayurveda where it could be brought into the practice on a daily basis. And that is why probably the apt way of celebrating the Ayurveda celebration on Ayurveda Day on 23rd of October is like by the theme Har Din Har Ghar Ayurveda. And this is what could be the definitely a very, very important message that we definitely should make some alteration, modification suitable to applicable to the present scenario, as our institution works with three basic motto of tradition, technology, and innovation. And that's what should be implemented in these aspects. And definitely when we implement this, we'll be able to adopt and apply to the general at par. As Emerald has rightly said, if you just think of practices, you'll be only hold with the practices, but we understand the rationality behind the practices and its principles, we can be able to apply it at large. So this is definitely the message that we'd like to put forward. So we'd like to thank the entire university, our Honorable Chancellor, Dr. B. Prabhakar Kore sir, our Honorable Vice Chancellor, Dr. Vivek Savaji, Registrar Kotiwale sir, my entire team of KLE Ayurveda faculties, and as well as my dear students for really being a part of this very unique team. I would like to thank all the three teams and their mentors, as well as the principals of these three institutions, and very, very importantly, all the people who have joined us online. There were more than 1,500 people who have registered for this particular event, and there were a large number of participants who have joined us online. We'd like to thank each one of them for showing their interest and keeping us motivated to come out with very new innovative programs in the coming future. Thank you one and all.
Thank you so much, sir, for your valuable opinion on this today's debate. And also, you are leaving one important message that which is very pride moment for all of us, that National Commission for Indian System of Medicine is going to consider this scientific debate which is to be debated at a global level in WAC. So we are very thankful for considering this scientific debate in upcoming events of national commissions. Thank you so much, sir. And we are thankful for the President as well as Chairman, sir, for considering this event for the global debate. So with this, I would like to hand over the mic to Dr. Prashant Gaonkar, sir, for Dhanyavada Samarpana, that is vote of thanks. Thank you one and all. I will give my pause to here to end the debate.
अत्रैव चतुर्थः राष्ट्रस्तरीयः संवादकार्यक्रमः समाप्तिमेति। अस्य कार्यक्रमस्य साफल्यार्थं मूलकारणीकर्ताः भवन्ति अस्माकं महाविद्यालयस्य प्राचार्याः डॉक्टर सुहास कुमार शेट्टिवर्याः। तेभ्यः सर्वेषां पक्षतः हार्दं धन्यवादाः। एवं संवादस्य आरम्भकर्तारः आसन् अस्माकं विद्यालयस्य पूर्वतनप्राचार्याः। सम्प्रति ते भारतीयचिकित्साप्रणाल्याः राष्ट्रीय आयोगे आयुर्वेदफलकस्य अध्यक्षः सन्ति डॉक्टर BS प्रसाद वर्याः। तेभ्यः अपि सर्वेषां पक्षतः हार्दं धन्यवादाः। एवमेव अद्यतन संवादकार्यक्रमस्य विषयविशेषज्ञाः आसन् अखिलभारतीय आयुर्वेदसंस्थायाः अध्यापकाः डॉक्टर शिवकुमार हर्ति महोदयाः। तेभ्यः अपि सर्वेषां पक्षतः हार्दं धन्यवादाः। एवमेव राष्ट्रस्तरीयसंवादकार्यक्रमे स्वविद्यालयतः छात्रान् प्रेषितवन्तः आयुर्वेदमहाविद्यालयस्य प्राचार्यः डॉक्टर प्रशांत AS महोदयाः एवं महात्मा गांधी आयुर्वेदमहाविद्यालयस्य डीन् वर्याः डॉक्टर वैशाली कुचेवार महोदयाः। तेभ्यः अपि सर्वेषां पक्षतः हार्दं धन्यवादाः। एवमेव अत्र स्थापना प्रतिष्ठापना वितण्डवादसदस्येभ्यः मार्गदर्शनं कृतवन्तः डॉक्टर श्रुति जोशी महोदयाः एवं डॉक्टर राजकुमार वर्याः एवं डॉक्टर प्रवीण भिरडी वर्याः। तेभ्यः अपि सर्वेषां पक्षतः धन्यवादाः। एवमेव कार्यक्रमे स्थापना प्रतिष्ठापना वितण्डवादसदस्याः सोत्साहं भागमूढ्वा संवादस्य साफल्यार्थं सहायं कृतवन्तः। तेभ्यः सर्वेभ्यः सदस्येभ्यः अपि धन्यवादाः। एवमेव अन्तर्जालमाध्यमेन एवमेव अत्र उपस्थाय संवादस्य रुचिं प्राप्तवद्भ्यः सर्वेभ्यः छात्रेभ्यः प्राध्यापकेभ्यः एवं नानादेशतः अत्र संवादकार्यक्रमे यूट्यूब द्वारा रुचिं प्राप्तवद्भ्यः सर्वेभ्यः अपि धन्यवादाः। एवमेव यूट्यूब द्वारा प्रसारणार्थम् एवं मंचस्य सज्जीकरणार्थं सहायं कृतवन्तः विनायक विवेक शुभम बडिगेर अरुण आनंद इत्यादयः। तेभ्यः अपि धन्यवादाः। एवमेव आमासं यावत् संवादस्य कार्यक्रमे कटिबद्धः आसन् अस्माकं विभागस्य अध्यक्षाः डॉक्टर सविता पी पडशेट्टिवर्याः एवमेव सहाध्यापकाः डॉक्टर प्रभाकर हेगडेवर्याः एवमेव डॉक्टर प्रवीण एन बेडीवर्याः। तेभ्यः अपि सर्वेभ्यः हार्दं धन्यवादाः। एवमेव मंचस्य पृष्ठतः अपि छात्राः वैष्णवी नाजरीन इत्यादयः सहायं कृतवद्भ्यः छात्राः। तेभ्यः अपि सर्वेषां पक्षतः धन्यवादाः। एवमेव अत्र संवादकार्यक्रमः समाप्तिमेति। वयं शान्तिमन्त्रेण संवादस्य कार्यक्रमं समापयामः। सर्वे उत्थाय शान्तिमन्त्रं वदामः। सर्वे भवन्तु सुखिनः। सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखमाप्नुयात्। ॐ शान्ति शान्ति शान्तिः। सर्वेषां कृते चायपानव्यवस्था अस्ति, ते कृपया स्वीकृत्य गच्छन्तु इति।
Unnata Chaipan, that is high tea, is being arranged. Okay, please, everyone. And I would like to request our beloved principal.